Hello colleagues, good morning. Thank you so much for the Ministry of Health through the Division of Reproductive and Maternal Health, and we will be glad to invite you for the conference, the 7th conference on adolescent and young people, sexual reproductive health and rights, which will be held in Mombasa.
Can get seated now. Thank you.
And now, allow me, my good friend. This gentleman to your left will provide us with a nice experience. I always say is not only to be heard, you experience him. Have you ever experienced a person? This is one of the people you experience. So, my good friend, whose name I shall not mention for now because he will introduce himself and his team, please take it away.
Thank you. For the girl who had to learn to breastfeed before she understood consent, I am sorry that you had to sprint your way to adulthood while your peers strolled towards their dreams. For not even children can dream if they have children to raise. But all in all, happy Mother's Day from a son who owes his life to a girl like you. This is Mama Alicia. Aliulizia, nikaambiwa mama alishare. Nilikuwa sad sikuimbiwa, juu mama alishare. Sitaki kujudge juu sijui reason mama alishare. Ni birthday yangu leo, yet another reason ya kumiss mom this year. Nakupeleka 92. Previous year nilikuwa only 2. Place ni Timao, base kambia Karao, usiniulize ni how. Chalia mother then alikuwa ni Karao. Yoni after wameachana na Mbuyu if ever washawai kwa pamoja. Ama ilikuwa tu blunder under influence ya booze ku hit under the belt after belt kwa lose kuanguka kwa toja. Break up after breaking news tu ni mwezi moja after na period imehata. Sa hizo mini embryo nishaanza kuform. Impulse za mother kwa systems zinani-inform ni kubaya nje. Chances za Mbuyu kukubali responsibility bado ni finja. Statistics zina point kwa possibility ya mi kwa brought up na single mom noise maker tangu. Speech bado haijaform but kwa uterus meshikilia mbili kokot kama mic. Nategea tani yangu ya kuperform. Defying the short sight ya kuchukua the easy way out. Yenye ingeniacha ndani ya paperback somewhere kwa damn site mother may choose to go strong. About 40 weeks down the line, June 1st 1989, Madaraka Day megeuka Labor Day kwake. Kemitano kwa hewa. Amebarikiwa na mvulana. Na Bilivili kwa ni furaha kubwa sana kwake. No man yeti yeye ni dem. Amepata mtoto nje ya ndoa na bado ana hustle. But familia kina baba mtoto ina uwezo. So naelewa iko tu hivyo voice kupeana mtoto kwa babake. Only that decades later, Huyu mtoto ni mtu mzima na bado anahangaika jua vile ingekuwa kangelewa na mamake, badala ya kuishi na baba wako haijuana jua la cha uzazi ufanye na mama na babake. Still pictures kwa album hazitoshi kushikanisha hizi dashed memories. Abandoned too early and I wonder kama hata why get to recover his hashed history. You worry about the mother and idea skeleton stashed kwa cemetery. No wonder sometimes you feel like it's just another baby sitting. You hata met then mother akiwa babysitting mostly ndi dadake mdogo aliachiwa. Maswali anayo tena kibao. But alisha sare kusaka answers just in case yawe source ya more pain yakijibiwa. Niliulizia nikaambiwa mama alishare. Nilikuwa sad siku mbili. So mama alishare, sitaki kujudge, sijui ilizo mama alishare. But yangu leo yet another reason ya kumiss mom this year. Thank you very much. Asante sana. My name is Dofanage. That's Rasa Moore on the keys. That's a Chiang on the vocals. And there was some other eating vocals somewhere. That's Jel Sakime. And welcome to the conference. We hope it's going to be a productive one and an informative one, because it's an important one. Adolescents and youth deserve health and reproductive matters, and they deserve to have their rights protected and safeguarded. So welcome, and thank you very much.
No. In English, you applaud. In poetry, we snap your fingers. So snap your fingers. That's poetic language for. Cool. Thank you.
Government representatives present, organizing institutions, representatives of partners and INGOs, youth leaders, media present, distinguished guests, ladies and gentlemen, all protocols observed. Good afternoon. It's so lovely to be here. I'm completely doing my news voice. He's about to be like, Janet, really? Why so serious? But it's such a pleasure to invite you all to the Rhnk, Adolescent and Youth Sexual and Reproductive Health and Rights Annual Conference. As our incredible spoken word artist said, this is one of the most powerful and important conferences on the continent, in the world. And we thank you all so much for making your way from different parts of the world to be here about an agenda that impacts each and every single one of us. And so I'm really happy to be here. My name is Janet Mbogwa. I'm a media person, author, founder of Inua Dada Foundation, which focuses a lot on SRH, storyteller, social issues commentator, author, and mother of two wonderful boys, and your co-MC for the next few days, Kizungu Mingi. Now, over to you, Eric.
So, I am MC Papa Mali, a noisemaker par excellence. I have a question.
Okay.
So the countdown, 5, 4, 3, 2, is it something that you're used to?
Yes. For those of you who may not know, I used to be a news anchor, so every time before you read the news, there's a clock that goes round. So I think that's why I was getting news anchor anxiety before I made my way to the stage. So yes, I'm familiar with the clock.
So is it the same clock that we see at home?
Yes,
So it's the same one you're using?
I think so.
So welcome, Janet. And I was going to give you an MC name, like a stage name, but we already share a name. Papa Mali. Mali is my son.
Yeah, and that's an incredible coincidence. My son is also called Mali. a different son, surely. Different. Different situation.
Different situation.
Yeah.
Different ages.
Different ages.
So we'll, well, if you may call us the Malis,
Yeah.
but we'll stick to Papa Mali,
I like Papa Mali and Mama Mali.
right?
That's a good one, right? Done. But remember, different situations.
So, yeah, so you see these people, very good people, nice smile, nice outfit. We see each other once a year, but we're in a committed relationship. I don't know how it works, but we've been there, right? And I'm happy because we have been in a 6-year relationship. Well, I missed out on a year. There's another year I was doing the other things. But we started out small in Eldoret, and now they are huge. Seventh year, my goodness.
A round of applause for that, and well done as well to the Reproductive Health Network. 7 years is a massive milestone.
My good. So what do you expect from the 7th?
From the 7th year, this is, I've interacted with Rhnk. Previously, this is my first annual conference. And yeah, I've seen a lot of incredible energy. I know that there's stands outside, so please make sure you also visit all the incredible partners whose work is being shown outside and throughout the conference. There's a youth cafe. Have anybody gone to the youth cafe so far? Hands up if you've gone to the youth cafe. Hands up, no? Oh, there's a few.
Oh, good.
Please make sure you make your way to the youth cafe. It's a beautiful setup. So I think for me, what I'm expecting is a lot of new learnings, bold conversations. You know, we need to also hear the young people and a lot more interactivity. And hopefully at the end of it all, we can leave with a solution about how we are actually going to actualize reproductive health and rights for everyone. So those are my expectations. What about you?
Well, I was hoping to learn a dance from Ethiopia and one from Zambia,
Okay.
and maybe one from you.
Not from me for sure, but I definitely love the idea of learning about other people's cultures. I think
Good.
you spoke to somebody from Sri Lanka. We have Malawi. We have a few other countries represented. So hopefully in the course of the few days, we're going to be able to do that. For now, though, I think we need to make sure that we kick off the program
For sure.
and listen in to our first speaker, and that is Nelly Munyasia of the Reproductive Health Network Kenya is going to come and give us the opening remarks. She will then invite government colleagues before we hear from a high-level panel. So a big round of applause for Nelly. Yes, as she makes her way to the stage.
Wow, this is just an emotional moment for me. The head of the Division Reproductive and Maternal Health, Kenya, Dr. AYSRHR, Director General, National Council for Population and Development, Dr. Sheikh Mohammed, keynote speaker, Miss Lori Adelman, our youth representatives, Lauren Elegwa, Felicity, Noma, all esteemed speakers, government representatives from across the region, esteemed delegates, the Reproductive Health Network board members and the Reproductive Health Network members, distinguished guests, all protocols observed, good afternoon. Good afternoon. Yeah, so I listened to the spoken words and I thought, do I even need to read a speech? But I'm reminded, yes, I need to make a speech. And importantly, because for me, it's time that we need to move from words to action. We cannot normalize conversations about triple threats, normalize conversations about adolescent issues. We need to put our words into action. And I hope that's what brings us together. Just looking through the room, looking at the delegates that are registered. looking at the delegates that are registered. This thing is yeah. We see a trend across the region where when you listen to the ministries, they are all talking about the triple threats. Is it okay? Yeah, I think it's okay. So it is an honor to welcome you all to the 7th Adolescent and Youth Sexual and Reproductive Health and Rights Scientific Conference, convened by the Reproductive Health Network Kenya in partnership with the Ministry of Health Kenya, and co-convened also by the Center for Reproductive Rights and HIVO's AYSRHR Fund. Today, we gather with a shared vision of a future where every young person across our continent can enjoy the full spectrum of their sexual and reproductive health and rights, empowered to make informed decisions about their lives and bodies. I know we struggle with the issue of consent, we struggle with the issue of making choices, and we think about what our countries allow when it comes to the issues around consent. I'm glad that some of the conversations will be around that, and we'll be looking at context, we'll be looking at privileges, we'll be looking at why do we have to, not allow young people to access services and information and peg it on consent. And we think about that girl from Uganda, the rural area of Uganda, who is 13 years, is married, lives with a sick grandmother, and she has to engage in transactional sex for her to earn a living for the family. And when she goes to a healthcare provider, the healthcare provider says, no, I'm not able to provide services because you need consent. And the sex she had was from, we call them boda boda, the motorcyclists. And just thinking of maybe at that time she was having sex, it was unprotected, and she was, transactional sex where she hoped she could get something to put food on the table because the grandmother is sick, bedridden, and is not able to go out and, earn something for them. So when we think about those compounding vulnerabilities and all those issues, where are we placing the lives of our adolescent and youth in our continent? Who do we expect to consent for them? Governments, policymakers in this room, how do we work around that to ensure that we are not denying them information and we are not denying them services? And these are the realities we encounter in the communities. I'm also reminded of Kajiado, where we have a young person who got married at 15. And by the time she was getting married, she had to undergo the female genital cutting because that's the rite of passage, and into adulthood she has to undergo the cutting and become a young mother. And she has no choice because it's the husband that then has to, who is an older man, that has to determine when actually they should have sex, so she has no power when it comes to sex pleasure. When she, in terms of the number of children, she's supposed to give birth to children on maybe an annual basis, so she even does not have an opportunity to grow as a young girl. Like he correctly put it, a young girl already pregnant, no consent, you have to quickly develop and become a woman and take care of a child. And those are the stories we face every day in our communities. I'm also reminded of the several commitments we've made as countries. And I'm so excited that today in this room, and just to giving it up to the government of Kenya that we work very closely with under NCPD, they've been at the forefront of ensuring that we are advocating for some of these commitments and ensuring that they are implemented. But we still have gaps. When you go to some of the communities that we work in, you will find that, some of the beneficiaries who are the adolescent girls and young women do not even know these commitments were made on their behalf. And they continue to face the social-cultural norms that deny them access to information and services. So really moving from talking to action. What are we committing in this meeting? What are we saying we are going to do as actors in the region? Because we cannot negotiate and continue having stories about the lives of adolescent girls and young women. If we had not been given opportunities, if someone had not stood up for us, we would not be here today. We can't repeat talking about commitments that were made. We need to be showcasing what we have done. Where have we moved to? Who do we need to hold accountable? And I am proud that as a local organization, a non-governmental organization, we are convening this meeting, and just to change the narrative that, you know, it only takes probably an INGO to convene, or it takes ICFP or Women Deliver for us to convene and have this important conversation. It is possible for us to have these conversations in our land, and it's possible for us to bring those conversations right at the table where the decision makers are, and bring the young people close to the decision makers, policy makers, investors, and hold them accountable in terms of how long do we continue to become adolescents that are pregnant? How long do we continue to not go back to school, or where we are needed to go back to school, you're referred to as a woman at the age of 13? You have policies that are only on paper. The reality on the ground is they are not able to go back to school because someone will refer to them as a woman. Someone will refer to them as a badly behaved girl who got pregnant at an early age instead of being in school. But what are the causes of them being pregnant at 12, 13 years? Is the information available for them? Is this information all available? We talk about age-appropriate information. Is it available for them? So really, I decided that I will not want to talk about commitments and the data. We know that. As we start off this convening today, is for me to challenge all of us to move from speaking to actions, to moving, doing your part at whatever level, grassroots, community. And I'm happy that a lot of delegates are the people that are implementing and doing fantastic work around adolescent and youth. But we need to do more. We need to push. We need to act. We need to call out if we have to call out, because we need our girls in school. We do not need them in homes as wives. We do not need them at home taking care of cattle and babies behind their back, another one breastfeeding and cooking. We need our girls back to school. We need our girls empowered, well-skilled, so that they can be able to take care of the society. We need a lot of leaders that we are seeing here today. And that can only happen when we collectively stand up together, when we collectively move from showcasing the work and pushing beyond. Thank you so much. I hope you enjoy Mombasa. I hope you enjoy Kenya. It's a beautiful country. Please feel free to, make sure you move around and see the amazing work that is being done by the partners. We have a youth cafe that is a very beautiful space. When we thought about the adolescent girls and young women in this room, we thought about a space where they can just sit and reflect and not get into, boring conversations from morning till evening, but have a space where they can have conversations amongst themselves. At the end of the day, they will be holding us accountable and asking us, RHNK, so what? You brought us here for 4 days, so what? We want for sure to be able to answer the so what. Thank you so much.
Nelly, before we take another step, always exuding so much passion, always feel I should call you doctor. I think you've earned it, right? How are you feeling for the 7th?
Grateful.
So are you want to invite some great people to speak to us?
Yeah, thank you so much. So at this point, I want to invite a friend, an ally, Dr. Jean Patrick, the Deputy Head of the Division of Reproductive Health, MOH Kenya.
head of Division of Reproductive and Maternal Health, Ministry of Health, Dr. Serem, Director General, NCPD, Dr. Sheikh Mohammed, youth representatives, all esteemed keynote speakers, government officials, esteemed delegates, ladies and gentlemen, all protocols observed, good afternoon. As you've heard, my name is Dr. Jean Patrick. I work for the Ministry of Health, Division of Reproductive and Maternal Health. And I'm here to welcome you to this 7th AYSRH conference. Karibuni sana, karibuni Mombasa. Thank you, Nelly, for setting the stage. I know adolescent reproductive health is at your heart and also mine. I'm very passionate about adolescent reproductive health, and we know what is ailing our adolescents and young people. We have the issues of triple threat, that is teenage pregnancy, sexual gender-based violence, and HIV. We also know they are grappling with drug and substance abuse. We also know there are the people who are dropping out of schools because of those challenges. And we also know the harmful practices that go on for that age group. And therefore, I'm happy to be here in this conference to discuss and prioritize what we need to do to advance AYSRH in the continent. As a ministry, we have done a lot. I know it is not enough. We are still working together with our partners, and we hope that this cohort is going to benefit. Adolescents are at the center of our programming as a Ministry of Health. Our policy environment is very enabling. We have strong policies that support adolescent health programming. We have the RH policy, we have the return to school policy, which allows girls and boys to go back to school, either after being rehabilitated or after getting pregnant, delivering, they are able to go back to school. As DRMH, we are also cognizant of what is going on. We have come up with the AYSRH strategy for behavioral change, where we are addressing issues of behavior change. We've also developed a parental guide to guide our parents on how to handle SRH issues. And these are documents that are all geared towards empowering the young people and their parents in order to navigate the challenges of teenagehood. We also have a new kid in the block. We are calling it self-care. And adolescents are also taken care of in that program for self-care. We've come up with documents. We are training health workers. And at the end of the day, we want to empower the young people, the adolescents, on how to take care of their own health. So kila mtu, health in your own hands, and we are pushing for self-care. The young people come out loud and demand for the services and ensure you're taking care of yourselves. As a ministry, again, we've ensured our data management is strengthened. Now we are able to get data for all the age groups, and it is well disaggregated so that programming is easy for us. You can always target whichever age group you are interested, and you will get the data that is needed. Counties have allocated funds for AYSRH programming. Initially, we had very few counties who are focusing on adolescents, but right now, almost all the counties have allocated some amounts for AYSRH programming, which is a good thing for us as a country. We've also trained our healthcare providers in order to provide adolescent-friendly services. And I'm here today to tell you that most of our facilities, more than 60% of our facilities, are offering youth-friendly services in this country. And that is a good thing. So in these 4 days, we need to get our priorities right. We have many countries here with us for these 4 days, and we need to share our experiences and get our priorities right for this age group. So before I invite the next speaker, I'd like to also invite you to our booth. We have MOH booth. Please ensure you pass by. We have so many documents that we need to showcase, and we will be sharing with you those documents. Self-care is one of them. I also want to invite you to our panel tomorrow morning. Ensure you come for the self-care panel in the morning, and in the afternoon you come for the postpartum family planning side event. So feel welcome. And now I take this time to invite Dr. Sheikh Mohammed, the Director General for National Council for Population and Development, to give his remarks. Thank you so much. Karibu Daktari.
So thank you, Dr. Jean. Good afternoon, ladies and gentlemen. It is, you know, when you're in Mombasa, it's a nice place to be. So, colleagues, you need to relax. Sindio, you need to relax. You know, I learned a few words, and I learned a word from Janet Mbugwa, what she's calling the news anchor anxiety. So it's also something we, in government, also when you're a speaker, also there's those anxieties, isn't it? The other one I learned from the gentleman, it's called orphanage, isn't it? Yeah, don't judge. So please don't judge me. Please say hi to your neighbor. Hi. Welcome to the 7th conference, Rhnk conference. This is my second time here. The first time I was in Kwale last year. And there's a reason as to why I'm coming back. So good afternoon and good evening. I'm happy to join you today in this 7th Rhnk conference, on whose theme is Priorities for Advancing AYSRHR in Africa. Why is this conference important to us? One, for me, it's very important because the area where I work is issues to do with population and development. And key thing for this continent is the potential of our youth. So anything that talks about our youth is always in my heart. So that's why personally I'm here. But also I'm here because of my institution. And it's because of my institution is because Africa is the youngest continent globally. And according to the UN, Sub-Saharan Africa will bear more than half of the world population between 2022 and 2050. Essentially, it means that by 2050, more than a third of the adolescent and youth aged between 15 to 24 will be an African. By 2050, 1 in 4 will be an African. This fastest growing population translates to an estimated 90% contribution to the working age population amid slum and backtracking economic growth in the region, World Economic Forum of 2024. Despite the growing population, with approximately 18 to 11 million African youth joining the working age population annually, in the next decade, Sub-Saharan Africa economics are slow in labor market expansion and poverty reduction. In 2022, 3 countries in Africa reported very high unemployment rates among the youth, that's 15 to 24. These were Libya, around 51%, South Africa, 51%, and Djibouti, around 77%. Unemployment stands out as the most prioritized agenda among African young people for their government to address. Amid all these challenges, African government can rise to create a formidable and globally competitive labor force through intensified investment in education and skill development, improve health and technology among youth to spark continental development. The 1994 International Conference for Population and Development goes down as a landmark in the history of development planning. That was 1994. Just 1 month ago, the UN celebrated 30th anniversary of the ICPD conference, a conference that was held in Cairo. This conference affirms the prioritization of human rights, reproductive health rights, and human empowerment, while calling for equality and respect of the rights and aspirations of the individuals. The 1994 ICPD prioritized quality population through implementation of health, environment, education, and the gender equality projects and programs, and support for vulnerable population. The landmark conference put population at the center of development and called for collaborative efforts by government, policymakers, private sectors, and civil societies, including women, and youth-led organizations and community groups at all levels in the implementation of the Program of Action, what we call the POA. Here in Kenya, the National Council for Population and Development captured the spirit of the 1994 ICPD through the adoption of the Program of Action in the sessional paper number 1 of 2000 on the National Population Policy for Sustainable Development. 10 years later, after the sessional paper, Kenya promulgated the 2010 Constitution of Kenya, which reiterated the 1994 ICPD as laid out in the Chapter 4 of the Constitution, Article 43. A very important article and a very important chapter in our Constitution. And this article says, every person has the right to the highest attainable standard of health, which includes the right to health care services, including reproductive health care, to accessible and adequate housing, and to reasonable standards of sanitation, to be free from human hunger, and to have adequate food of acceptable quality, to clean and save water in adequate quantities, and to social security and to education. A person should not be denied emergency medical treatment. The state should provide appropriate social security for persons who are unable to support themselves and their dependents. And Article 42, every person has the right to clean and healthy environment, which includes the right to have the environment protected for the benefit of the present and the future generations through legislative and other measures, particularly those contemplated in Article 69, and to have obligations relating to the environmental fulfilled under Article 70. These are just examples. Otherwise, we have others such as the right to life, privacy, information, dignity, and discrimination, a right to family, among others. Inspired by both the 1994 ICPD and the new Kenya Constitution, the National Council for Population and Development came with the sessional paper number 3 of 2012 on population policy for sustainable development, which aimed at harnessing human, especially the youth potential, for accelerated socio-economic growth of the country. In 2019, Kenya renewed its commitment to implementing the Cairo Program of Action during the Nairobi Summit on ICPD 25 held in Kenya. The government committed to accelerate progress toward socio-economic transformation through prioritization of human capital development, putting adolescent and young people at the center. The country commitments took note of the ICPD rallying call of leave no one behind and marching for the elimination of the 3 zeros: zero unmet need for family planning, zero preventable maternal death, and zero harmful practices. The Kenya National Population Policy for Sustainable Development embraces a holistic approach in harnessing human capital potential for sustainable development. Apart from being human-centric, the policy remains all-inclusive and calls for a collaborative approach, just as spelled out in the 1994 ICPD Program of Action. So this year's conference, whose theme is prioritizing for advancing AYSRHR in Africa, the government of Kenya prioritized adolescent and youth issues, not just around the health, but overall issues of human capital development, which focuses on health, education, and economic development. This can be traced to the various policies in the youth policy, the policy framework for education and training, as Dr. Jean has talked about, the return to school policy, advocating for compulsory quality, relevant and equitable basic education under the principle of universal access to education for all children. The adolescent and youth health policy is currently under review formulations. I know we have the previous one of 2015. Over and above, recognizing the negative impact of especially adolescent pregnancy and other challenges leading to school dropouts, the government came up with the return to school policy guidelines implemented by various entities. NCPD and Kenya Commercial Bank Foundations have mentorship program and a scholarship project that supports adolescent mothers to return to school after giving birth. Meantime, the goal of the recently launched Kenya Population Policy we just launched just 1 week ago for sustainable development is explicit: to attain the high quality of life for the population of Kenya that is secure, healthy, broadly educated, trained, and empowered for sustainable development. This goal is clearly an inspiration for prosperity building through harnessing the potential of the Kenyan young population. Over and above the policy framework and most of the ICPD 25 Kenya country commitments relate to the young people, directly or indirectly, their health, education, skills, well-being, and livelihood, among others. So there is interventions which is going on currently, and I think Nelly has talked about, and even Dr. Jean has talked about, is about what we call the triple threat. The triple threat is something we coined on 3 items. That is ending HIV, gender-based violence, and teenage pregnancy. We realize issues of teenage pregnancy, the approach we were taking as a government was not a sustainable approach, because we have teenage pregnancy is that very young girl. When she drops, the Minister of Education just focus on issues of education, how many girls dropped out of school and how many are coming back to school. The Minister of Health just looks at how many came for antenatal, how many missed antenatal care, how many delivered. The Minister of Gender just looks at the gender lens. So we thought, since this one is one girl who needs to go all this process, then we must have a multi-sectoral approach. And then we came with this, combined with HIV, because it starts with that single sex, and comes with HIV, and comes with pregnancy. We said as a government, we must have a one-sector approach. And we have a national steering committee chaired by the Principal Secretary for State Department of Economic Planning. And then we have other anchors, brought in the religious leaders, the Parent Teachers Association, and many other sectors. So you can just fit your activity within that kind of framework. Our intention is to have, if possible in the future, to have an act to address this issue. And that's the campaign in Kenya. Right now we are implementing what we call the triple threat, ending HIV, gender-based violence, and teenage pregnancy. On the bottom-up economic transformation agenda, which is the agenda of the government of Kenya today, has prioritized creation, promotion, and enhancement of the digital superhighway and creative economy, which specifically targets the youth with good quality education, especially in science, technology, engineering, and mathematics, and skill building. Young people have the dynamic potential of using technology to create and innovate, as well as remain competitive in the global market. So ladies and gentlemen, these are some of the interventions. I'm sure Dr. Serem will talk more about it, but the government of Kenya has prioritized issue of youth, and that's why really we're here to give you the moral support, so that at least in our population of the youth aged between 10 to, let's say in Kenya youth we call them up to 35 years, but those aged between 10 to 19 years are approximately around 13 million. And as a government, we want to make sure that these youth don't miss their potential. Because in Africa, the future of Africa lies on their youth, and the future of Kenya lies on their youth. What we are saying, we are in a transitional period where as a country we are moving from a child-based population to a youth-based population. And any threat that will affect our youth will be a threat to our national existence. And that's why we're saying issue of gender-based violence, HIV, teenage pregnancy, mental health issues, drugs and substance abuse is a threat to our national existence, and we must fight with all those kind of threats to our youth. Thank you very much, and may God bless you. Shukran.
Thank you so much, Dr. Sheikh, for the remarks. And it's good you've reminded us that we are a youthful continent. And it's interesting if by 2050 we count 1, 2, 3, 4, and one of us will be an African. So we have the opportunity to harness demographic dividends. So young people in the room, it is your time. So let's harness this together. And now take this opportunity to welcome our chief guest, Dr. Edward Serem, to give us his remarks. Karibu sana, Daktari.
Sorry.
Thank you. Thank you, Dr. Chin. As she has said, my name is Dr. Serem Edward from the Division of Reproductive Maternal Health at the Ministry of Health. I'm here on my own capacity as a champion for the youths. And at the same time, this afternoon, I've also brought apologies from our Director General of Health, Minister of Health, that is Dr. Patrick Amott. Dr. Patrick Amott was supposed to come to this event, and he was supposed to come and give a keynote address. However, because of the fluidity of the top government officials, things change, and most of the things are emergency. At this juncture, therefore, it is delegated to me to read his speech, and I'm going to read the speech which he has sent me with. The Director General, NCPD, honorable guests present, distinguished delegates, esteemed participants, ladies and gentlemen, good afternoon. I'm pleased to join you during the 7th Rhnk, Adolescents and Youth Sexual Reproductive Health and Rights Scientific Conference, which is beginning today for a whole week. The conference offers us time to reflect on our progress over the past year, where each of us made several commitments in partnership with MOH, to improve adolescents and reproductive health rights. The onset of adolescence brings not only changes to their bodies, but also new vulnerabilities to human rights abuses, particularly in the areas of sexuality, marriage, and childbearing. This year's gathering gives a platform where AYSRHR stakeholders across sectors and across different countries represented here will be engaging in discussions around this year's theme: priority for advancing AYSRHR in Africa. This is towards addressing unintended pregnancies, new HIV infections, gender-based violence, maternal deaths, school dropouts, mental health issues, and substance abuse. Special mention for the well-being of adolescents and young persons in correctional facilities around the countries. Ladies and gentlemen, the reproductive health journey begins early in life, with our environment having a strong influence on the reproductive outcomes of the children. Parents, guardians, teachers, health providers, religious leaders, and governments play part in safeguarding sexual and reproductive health. The adolescent and the young person stage of development is significant, unique, intense, and involving. We need to prioritize access to age-appropriate health information, more robust and better coordinated reproductive health services, and nation and partnership to foster optimal growth and development for adolescents and people to positively safeguard their health. Kenya is committed to international and regional commitments. And that one is also outlined in our Constitution of 2010. Kenya has made significant strides in expanding access to quality health services, including reproductive health services, and increasing availability of youth-friendly health services. This has resulted in a decrease in teenage pregnancy from 18% in 2014 to 15% in 2023. We've also seen reduction in FGM, HIV, and gender-based violence has stagnated. The government is committed and is keen in ensuring that in the rollout of universal health coverage, the benefit package for adolescents and young persons is comprehensive. Ladies and gentlemen, our gains are yet to overcome some challenges, which include cultural, harmful traditional practices, insufficient health information, and inadequate resources. We choose to re-strategize and overcome the challenges. Multi-sectoral engagement is key in addressing the various challenges experienced by those affected by unintended pregnancies, new infections of HIV, mental health, school dropout, and substance abuse. We must therefore expand the fiscal space and related investments towards adolescents, young persons, sexual reproductive health response. As I conclude, I want to take this opportunity to express my gratitude to all those who have contributed to the progress so far. I look forward to working with you to continue a healthier and more prosperous environment for the adolescents and youth and young persons. We must continue to work together as a government, civil society, and international partners in this space under the umbrella of the multi-sectoral approach to continue supporting the ministry and foster concerted efforts in fighting the adolescents and young persons issues which are affecting us. We need to end unintended pregnancies and prevent and end preventable maternal deaths. We need to end HIV transmission, STIs. We need to end gender-based violence. We need to end female genital mutilation, hopefully and prayerfully by the year 2030. It is fundamental to enhance awareness creation at the community level on AYSRH issues and how they can be averted. The clock is ticking. It is time to end unintended pregnancies, new HIVs, early marriages, gender-based violence. Let us all join hands and make it happen. With you all, I wish you fruitful deliberations during this conference. And let's keep up the momentum in advancing AYSRH policies and strategies. Thank you very much, and God bless you.
No. Another round of applause for the good doctor. Let's keep that momentum, and we need to check something. Call this the elbow check. So, do you feel your elbows? Do you feel your elbows? I need you to check the elbow of your neighbor. Check them. Be elbow friendly, do not hurt them, cause no harm. Cause no harm. And tell them you're stuck with me for 4 days. So keep the momentum. Now that you've checked your neighbor's elbows, I hope they're okay. A reminder, if you haven't downloaded the program, you can scan me. Not me, but at the back of your badge, there's a QR code. And if you, perchance, do not have a smartphone, please tell your neighbor please assist me, okay? And once you scan the program, remember at the very end of the program is the program for the Youth Cafe booth. Please visit the Youth Cafe booth. Am I talking with 2 microphones? It's crazy, huh? So Youth Cafe booth, they have a very nice, lovely program running all the way to Friday. Interesting things, World Cafe with a twist. Digital Innovation Challenge. Participants rotate between tables. Social Accountability Challenge. Sounds like fun, right? And you know what? One thing is fun is how we'll dissect priorities for advancing AYSRHR in Africa. And Dr. Serem said, I wish you fruitful deliberations. And before we get into the first fruitful deliberation with MC, Mama Mali, and her esteemed panelists, I'd like us to just show a video package. I had the privilege of riding with some Gen Zs. Gen Zs? Where my Gen Zs at? No, don't have kind of energy. Gen Z? We're discussing your priorities and they're doing me like that, eh? Gen Z? Where my Gen Zs at? So the only reason it's a bit low is because we were riding from Nairobi to Mombasa County, right? So they're recovering, but they still have the energy. And I want us to see what we are doing on the road. It was a privilege riding with the young people, man. I'm older now, but I'm sure, Dr. Sheikh, when you're my age, when we were younger, we used to do other things. But I'm happy that we have the young people here, and I'm happy that they set the momentum as we rode from Nairobi to Mombasa so that we can come and tell you what our priorities are. And the hashtag was? What? What youth want? Sindio? Yeah. Roll the footage. Is that how we say it, Janet? Roll the footage. Okay, let's see the footage before. Round of applause with some youthful energy, please. Galian, oh, you can do better than that. Galian is my former boss, so this is the only time I get to bully her. So yes, so MC Mama Mali, please do that the honors of dissecting this theme. Priorities for advancing adolescent, youth, sexual reproductive health and rights. Oh, I should have helped you. I should have helped my.
I'm telling you.
I was a bit slow. I didn't follow the script. I'm sorry.
It's okay, so Papa
welcome.
Mali. You rode in the bus with the Gen Z, didn't you?
Yeah.
Okay.
And I was teaching them some moves, right? And they taught me some moves, so
we'll
they're
get
good
to see
people.
it soon.
Yeah, good vibes.
Okay.
As they say.
Good vibes.
Yeah.
Thank you so much,
Welcome.
Papa Mali, for the introduction. And I will be inviting my panelists on stage soon. Also, just want to make sure that we have enough microphones for everyone just before they make it on stage. I know we have mine. We have one here. And perhaps a request to maybe have 1 or 2 more. Okay. Please feel free to bring them on stage so that once our panelists are seated, we are able to have the conversation. Thank you. Okay. I'll be calling up the panelists soon to get into this conversation. First, a panelist that we have already heard from. He spoke earlier as part of the opening remarks. And so we'll invite him, and just to keep the conversation moving, and because of time, we'll just begin to invite you all to stage. So Dr. Mohammed Sheikh, Director General, National Council for Population and Development, NCPD Kenya. Please feel free to make your way to the stage and sit right next to me on this side. Yes, we can applaud them as they come. Felicity Norma, Youth Focal Point, FP 2030 Nigeria. Welcome to the stage. Thank you so much. Dr. Mohammed will sit here. Felicity, you'll sit right next to him on that side. Yasmin Chandani, CEO in Supply Health. Please make your way to the stage. Galian Pahaye, Deputy Director at IPPF Africa Region. A round of applause for Galian as well. And finally, we have Dennis Bwana, SRHR Program Officer at the Eastern Africa National Networks of AIDS and Health Services Organizations. Karibu sana, and a round of applause for him as well. Yes. Each of our panelists has some representatives, I guess, and fans in the room. And also, this is a good panel, right? We're balanced out in gender, demographic. This is how panels should be, note to people. And of course, Felicity, because this is essentially about young voices, so thank you for representing them on this panel. So we're going to get into a round of questions, and then a second round, and then hopefully allow you to ask one or two questions. We know that the program started slightly late, so we also want to make sure that we're able to move things along and not keep you for too long. And also, as I ask some of the questions, you'll notice that I'll give some context, right? So if it sounds like I'm taking a while to get to the question, it is context. So please listen in. The context is important. It sets the tone for why these questions are being asked and why our experts can answer them. So first of all, welcome all of you. Thank you so much for being here. We'll start with you, Dr. Mohammed Sheikh, and you've already spoken quite passionately about especially the journey of ICPD, which I remember us marking in Kenya in 2019, and I remember being a part of that. And so the question for you is, this year's conference theme is Priorities for Advancing AYSRHR in Africa. And you may have already touched on this, but if you could please briefly talk to us about what the government of Kenya is doing to advance AYSRHR, and what have been your successes and your challenges. Kindly.
Okay. Thank you, Janet. Good afternoon again. I will be repeating myself.
Maybe you can speak to the successes and challenges. It should be on, but you can use mine.
Okay. So, I think to start with, the success is, one of the successes is this conference, is it? We're here because of the success of the government of Kenya to allow to have a conference like this, isn't it? So let's clap for the government of Kenya first. But generally, as I told you, 30 years ago, the world had a meeting or a conference in Cairo, Egypt. And that conference was on about population issues, and in particular, the issues of putting reproductive health as a priority. And from then on, Kenya government has really put issues of maternal health, child health, youth health as agenda number one. And one of the success is, if you look at our indicators, specifically, if I just give you the last Kenya Demographic Health Survey, on one of the indicators is just on teenage pregnancies. And in the agenda that really we have made sure that at least we reduce. Every year in this country, more than 300,000 girls below the age of 18 years get pregnant, either wanted, unwanted, missed, mistimed, whatever you call it. So those 300, some of them is because of traditional culture. But the issue is that they're losing, or they're dropping out of school, or they're not going to school. And you know, a population of 300, every year in this country we add 1 million people, either more than one. That's the addition we make every year. So if 300 of them every year are dropping, and they're not achieving their human capital or the human potential, then that's a loss to our government or to our nation. And that's why we have put efforts to make sure that issues of girls and boys is prioritized. So one of the indicators is that teenage pregnancy has reduced. I think right now we're talking about 15%. Another agenda is about issues of female genital mutilation. I think this is the only country with an act and with a board ending female genital mutilation. So I think also you need to clap for the government of Kenya. So generally what I can say is that, as Dr. Serem has talked about it, and Dr. Jean has talked about it, efforts are there, but they are not enough. We need to put more efforts We need to put more priorities. We need to put more resources on issues to do with the youth, and specifically about issues to do with advocacy, education, awareness creation, and their safety. So I think generally I will stop there, but that's, I think, some of the interventions we have done and some of the successes in terms of AYSRHR program. Thank you very much.
Thank you. Did you highlight any major challenge? I know you talked about teen pregnancy and unwanted pregnancy being an issue, but we're speaking to successes and challenges. Is there any major challenge that you'd like to highlight as well?
So I think challenges are there, and they're quite a number. But issues to do with cultural issues, socio-cultural issues, I think is a challenge. When you come to now issues to do with teen pregnancy, majority of those girls who get pregnant are early marriages, child marriages. And some of the other challenges is issues to do with poverty, because a big factor, a driver of these issues is poverty. So we need to address issue of dependency ratio. We need to have programs for girls and boys so that at least they're able to complete their schools. And many other challenges, which is something to do with the changing life pattern of our nation. We are moving from a rural to urbanized, and you know, the urbanization also is coming coming with other challenges, because with urbanization, the settlement is not really an adequate, you know, what you call a proper settlement. Majority of the population are living in slums and in areas which are not very suitable for human settlement. And with that comes with its own challenges. The families are not really have no proper houses. So those challenges really affect the children. So the challenges are there. There are multiple challenges. But then what we need is to come with innovative ideas, proper system to address those challenges. And one of the things that I'm talking about, the triple threat, we realize is that one agency cannot do those interventions. That's why really we brought it as a one government approach with our partners. The religious leaders are there, the parents are there, and each one of them have a role to play. And that's why we have that kind of program. So I think challenges are there, but we're addressing. And hopefully, as Dr. has said, by 2030, some of the indicators, we want them to be at least zero, if possible. Thank you very much.
Thank you. When we come back to Dr. Mohammed later, we'll be asking about whether youth who are sexually active should be allowed to access family planning services. So it'll be interesting to hear the government's take on that. Felicity, for you, this is around technology, right? Something that's pretty widespread, especially on the continent. It offers many opportunities for advancing AYSRHR. How are NGOs using technology to increase access to AYSRHR services?
Okay, thank you for that question, Janet. And like you said, that technology is something that the continent, is prioritizing. And let's just do something very quick. How many of us have the program, hard copy of the program here? Hard copy. Okay. So you can see that so many of us do not have the hard copy, rather we have the soft copy. And the organizers have made it easier for us to access this program. So this is what technology does. The theme of this conference is prioritizing and advancing AYSRH in Africa. Priorities for advancing AYSRH in Africa. And one of the priorities that we need to be, looking at or focusing on is technology, leveraging the use of technology to ensure that we improve the reproductive health outcomes for young people, for adolescents and young people. Looking at where I come from Nigeria, and I know so many of us know that the continent, we are the most populous population in Africa. We are over 200 million population in Africa. So, so you can imagine the level of accessibility, for young persons. A lot of young persons do not access information and services. How can we reach these young persons with this population? And it's also important to know that over 70% of the population are young persons. So you see that there is a lot of challenges when it comes to reproductive health for young persons, especially those in the rural areas. So how do we ensure that, technology, we utilize technology to improve and to ensure that, young persons have access to this information? Now, we are ensuring that we use mobile platforms. So we've been able to develop Frisky apps. So this is like an Android app that ensures that, young persons have access to, accurate information on STIs, on HIV, on, family planning. So, and it goes a long way because so many young persons have smartphones, so many young persons now are on social media and all. So this helps young persons to have, that information they need. And also another intervention that we've also come up with or developed is U-Plan. So this is a WhatsApp chatbot. What it does is that it helps young persons to have, to be able to ask questions, whatever issues, and, it covers the area or the challenge of confidentiality for young persons, and this is like a key challenge for young persons, the issue of confidentiality. So all you just need to do is download the app, and then ask questions. You can ask, or if you're having any issues, you can just ask questions. So what the chatbot does is that it responds to you, tells you the nearest service delivery point that is close to you. And then another thing too that we've also come up with was we piloted a project called the Youth Hangout. So this was like a youth-led project. I was the project manager for it. So what this project was about was we leveraged on technology, on even the traditional media, use of the radio, and also ensured that we live streamed those programs. So we addressed several topics that affect young persons on radios, and it was also live streamed. So this helped us to reach a wider number of young persons as well. And also this project was also awarded by UNFPA. It was a project that ensured that young persons on their own were able to come up with very significant or important ideas on how they want their needs to be addressed. And then another intervention too that we also came up with was Test for Life. So this was like a dialing code number that when giving the code, you just like don't need to input it in your phone, and it helps you to ask questions and also get the information that you need. Then another area too that NGOs are also doing well, because I work with FP 2030 as the youth focal point. So part of what is like important for us is data collection and analysis, which helps NGOs to collect data about the prevalence of these issues, STIs, teenage pregnancy, because the truth is that we need data to be able to plan our programs. We need data for our advocacy efforts. So data is really very important for us. And then another thing too that we've been able to achieve is we recently launched the FP 2030 AY strategy. So this strategy was focused on 5 pillars, and one of them was looking at data decision making. So what does it tell us? It tells us that we need data to be able to plan our programs. And also we released the FP 2030 measurement report, which shows that with indicated funding inside, and also the contraceptive usage so far according to the different age groups. So when we are planning our programs, our projects, we need data to be able to inform us. Then another thing that we also looked at was training and capacity building. So for FP 2030, what they ensured was that they supported youth-led organizations, to be able to train young persons, and also they train with the youth focal points, right, for us to be able to have the advocacy skills to advocate in our different countries. And this was also done virtually. So we used the virtual platforms to be able to achieve this. So what we are trying to say in essence is that technology is very important to improve the sexual and reproductive health outcomes for young people, and also to help us to address the triple threats, which has been mentioned earlier by the speakers. Thank you.
Thank you so much. And Felicity, I hope at some point you'll be able to lead us to where this information is available. I think those are very key examples of how technology can be used that might be useful to people in the room. So hopefully later you can lead people to where they can interact with or see the technology that you're talking about. Thank you for that. Yasmin, again, this is kind of leaning on innovation, but in a different sense. What innovative strategies can be employed to diversify and expand the range of family planning methods available to young girls and adolescents, ensuring that these options are not only accessible, but are also culturally acceptable and tailored to their unique needs and preferences?
Thank you so much, Janet. And thank you to Nelly and RHNK for convening us all, because I think the most powerful sign of progress, as Daksari said, is that we have a room full of all of us who are aligned around the same thing. How can we prioritize and advance AYSRHR for, young girls, adolescents? I'm going to respond from the perspective of the system and build on what Dr. Sheikh and Felicity have said. So at InSupply, we work a lot on access, and we work on supplies availability. And when we think of innovative strategies, I would say 3 key messages. And these are not exhaustive, but just from the perspective of the system. So more methods, more agency for methods for young girls and adolescents, and more channels. And to give a bit of context and to build on what we've heard already, we've heard about a lot of the cultural barriers. And we've also heard that the ministry has made great strides. The ministry has a total market approach in Kenya that is so far advanced. It's looking across all sectors and saying, for us to have FP as a development agenda, we need to look at the total market approach. We can't just look at one sector. And that is a really great policy because it opens up access channels across all segments of women. And when we look at Kenya's recent DHS, we see that we've made really big strides in modern CPR. But who is being left behind? And I think that's the focus of today and of the next 4 or 5 days. We know that the health system right now does not adequately respond to the needs of adolescents and young girls, women, and this is what we need to advance now. So how do we close the gap between our very advanced policies and implementation? And I'll talk a little bit about some of those. So one, I said more methods. And I think if we look at the methods that are existing on the market, the methods are not bad, but do they give young girls and women enough choice? There's a new method on the market, DMPA-SC, Sayana Press, which is a self-injectable. And I think you heard Dr. Jean talk about self-care. We need more methods that put the power of choice and decision-making in the hands of young girls, adolescents, and meet their needs and their preferences. So really, DMPA-SC is one of many methods that are in the pipeline that will be coming. And it is so important that we listen to the voices of these young girls and adolescents in order to close that gap between policy and implementation and increase access. And technology is such a powerful tool. Information is so powerful, but we still need to give access, and we need women. We need to hear from these young girls and adolescents. What is their pain points right now when it comes to access to modern methods? And what are their pain points when it comes to channels? One of the things that we are doing in partnership with the Ministry of Health is to look at the pharmacy channel as an accessible channel for young girls and adolescents. We know that many of them do not want to go to a public health facility and queue for hours. There's a lot of stigma, there are a lot of barriers there that will prevent them from accessing modern methods. If we rely on a busy, crowded public health facility, they may go in, they already get stared at, they're around people who are 10 years older than them. The facility provider may not know how to speak to them in a way that speaks to their concerns. So we need to think of different channels. Community health promoters, pharmacies. How do we make those youth-friendly providers, not only in terms of meeting girls and women where they are, but also having the supplies they need? They can't just come in and many of these young girls come in They know what they want. They want an emergency contraceptive. They want this because they want to be in and out. Do they really know what that means for their health? Do they know what it means for their reproductive health, for their ability to plan their families later? It may not be the case. How do we empower these healthcare workers to be advocates for these young girls and adolescents? How do we also equip them to have all the supplies they need in stock so that they can serve these young girls and women? And how do we create channels in all of our countries, not just in Kenya, that allow a full pipeline and method choice for these young girls? So all these young girls and adolescents can walk into any facility. They can go to a community health worker. They will feel confident that it's a safe space for them to ask the questions they have, to not feel judged or stigmatized, but also to access whatever service they need, to get information that tells them, this is the choice I need to make for myself, and this is where I'm going to get that method that I need to protect myself. One of the earlier speakers, that stay in school for another 10 years, for however many years they need to stay in school, so that we as a country can move forward, but also so that they as individuals, as potential family members in the future, they can have control over their bodies and their choices as they move forward. So I'll stop there.
Thank you, Yasmin. Please remember, we'll have a chance hopefully to take one or two questions after this. So I hope you're listening to these points that are being made by our panelists so that you can come back with a question as well. Galian, this is the context to your question, so I'll just start off with that. SRHR intersects with gender parity and participation of women in socio-economic development. In countries where adolescents have poor access to SRHR information and services, the girls are likely to be left behind, and there is a serious disparity in political representation as well as women's leadership in private and NGO sectors. And, you know, the theme of leaving behind, I think, is also something we've just heard Yasmin allude to. So what are some of the good AYSRHR practices that countries should adopt to increase participation of women and girls in socio-economic development?
Thank you, Janet. That was a long question,
yes.
Right? So I hope everybody has been following up. So basically, the idea here is that, you know, when you say what can country do, countries is a broad terminology. You know, one can understand what should governments do. You know, they are the main duty bearer in a sense. You know, but everybody has a role to play. I'll try to focus maybe a little bit more in this response on the role of the government, and I will be speaking under under your supervision, as you're better placed as a government player. But basically, I also want to follow what Nelly has been saying in her opening remarks this morning. You know, we need to be moving from speaking to action. So I'll be trying to be a bit concrete and suggest things that, you know, governments and actors who are working together with governments can do in order to work on this gap and to support women and in particular adolescents and girls in accessing these leadership positions. So one first thing that comes to mind, and I'm sure our colleague here will agree, is that basically governments have to adopt a whole government approach. SRHR issues, and in particular youth and adolescent SRHR issues, are not only a question to be dealt with by the Ministry of Health. You know, it's a question that has to be coordinated amongst different ministries: education, health, social affairs, women's affairs, finance, etc. So there needs to be a holistic approach to looking at these themes and these issues from a social, legal perspective, and also looking at a life cycle approach of women. And of course, you know, this can only be better if there is a strong political will from the highest level, you know, from heads of state, of government. So this is why it was also so pleasant today to hear, you know, these commitments from the Kenyan government. A second point that I want to highlight is that we have to start young. Education is key. Basically, we need to prioritize the education of girls, and girls in all their diversity. You know, including girls who are young mothers, girls from low-income families. For instance, what can we do, or what can governments do? They can provide scholarships for girls who are coming from, you know, low-privileged families. We can also ensure schools have the necessary facilities, for example, safe bathrooms or access to sanitary products for girls. Of course, comprehensive sexuality education is key. It needs to be integrated into the national curriculum. We need to ensure that it's age appropriate, culturally sensitive, and that it covers topics such as consent, autonomy, bodily autonomy, and healthy relationships. A third point that I want to raise here is policy development. We need to enforce policies, because very often what we see is that there are beautiful laws and regulations, but they are not implemented or acted upon. So there needs to be, action to really end harmful practices such as FGM, child marriage, and we need to be also supporting poor and vulnerable adolescent girls. So this comes with laws that are enforced and also, of course, running community outreach, for example. We must develop guidelines and services that really prioritize SRHR of women and girls. And these services, they must be free from stigma, and they must be free from moralistic constraints. So this includes, of course, access to modern contraception, abortion, and comprehensive SRHR care. We need also to be thinking about establishing youth-friendly clinics where young people can come and speak openly about their SRHRs without being judged. Finally, because I know I only have 5 minutes, on the social level, we need to make intentional efforts to end harmful practices and dismantle harmful gender norms and stereotypes. And this can be done by all of us, of course, and it goes through using social media and public education, CSE, to be able to pass this message to the youngest population. Thank you.
Thank you so much. There's some very interesting ideas coming from this panel, and I hope we're taking note, whether it's youth-friendly facilities, which Gayan has talked about, Yasmin talked about, agency, which I really want to speak about at some point, and then, of course, Felicity spoke about the power of technology. So please, let's take note of some of these very interesting, innovative, progressive ideas that we can adopt, and also in the meantime, we can take stock and see, are any of these actually being adopted? And if so, what is the progress? What is the scalability? So as you're listening, I hope you're also having your mind run about the possibilities of these implementations. Dennis, again, some context ahead of the question that I have for you. The global and regional policy frameworks for AYSRHR are progressive, and if fully implemented, because as we say, the policy is one thing, but implementation, as we say in Kenya, qua ground, is usually a different thing. But if fully implemented, they could change the landscape of the AYSRHR indicators in Africa. An example is the ESA commitments that provide for sexuality education and the Maputo Protocol that provides for safe abortion in cases of rape, incest, and to save life. The challenge is that most of these countries find it difficult to fully implement the global and regional SRHR policy frameworks. So what then can be done to improve implementation in African countries?
Thank you so much for that long question. Once again, I'm Dennis Bwana from YANASO, Eastern African National Network of AIDS and Health Services Organization, and currently implementing an adolescent SRHR project called SHARP, Solution for Supporting Healthy Adolescents in the Great Lake Region countries, Tanzania, Kenya, Rwanda, Burundi, DRC, Congo, and Zambia, being part of the project. And I like the way you have coached the question, and basically to touch two very crucial documents at the regional level. That is ESA commitment as well as Maputo Protocol. Starting from the ESA commitment, what is good with ESA commitment is the wording that our ministers for health and education used in that document. It starts with the word, we, the ministers of health and ministers of education. And then it goes down to the acknowledgement. They are collectively acknowledging the challenges facing young people in the ESA countries. And again, it goes down to the duties where they are taking consideration of the need of governments to completely implement the documents if they are to rescue the situations of our young people. But something surprising is that the implementation status of these two documents, the way the communities and adolescents themselves can really get to know how far has the government done in terms of implementation of these documents is still a challenge. And I'll give you an example of Maputo Protocol. I'm happy that in 2021, Kenya became the 17th country out of 42 to file the shadow report on the implementation status of the Maputo Protocol. So if you take 17 out of 42, that tells you still implementation is not that much good. Because if you have done everything as you committed by ratifying to the document, probably you cannot miss a report. Missing a duty to report impliedly indicates that either you have not done enough or you have done but not to the expectation. And most of these countries ratified, you know, with these international documents, there are very key important stages that we must be monitoring as the communities. The ratification is just one thing, where head of states or ministers celebrates ratifying the document. But that ratification alone is not enough, especially when it is done with some reservations. Taking an example of Maputo Protocol, it is a very good and standing AYSRHR document, probably in the region, that needs to be celebrated by everyone. But a bad luck that most of the countries that ratified to the Maputo Protocol still had some reservations. And most of the reservations are under Article 14(2)(c), that is on abortion. And I think, as the government probably, the way we put our data, we normally generalize informations. Listen to what happens in DRC in regard to the Maputo Protocol, when they were also struggling with that reservation on abortion. When they did a study, then the results showed that 17% of the maternal mortality rate, 17% of the maternal mortality deaths in DRC were a result of illegal abortions. So then they reconsidered a need of still maintaining the reservation on Article 14(2)(c) that speaks of a need of an abortion. If you come to our countries, we are closing our eyes as if abortion is something that is not happening. Yet if you take your minds back home, at least 10 houses from where you are staying, you might find 2 or 3 abortions being done. And they're illegal abortions. Why are they illegal? It's because we still keep the reservation under Maputo Protocol on Article 14(2)(c). And then, how then do we ask these questions as young people? There's a moment for reporting. The Article 62 of the African Charter provides a mandatory requirement for partner states, for parties to that protocol, to be reporting on a certain period of time. That report is generated from the duty bearer's point of view, and it is tabled before the Commission. What is the engagement of civil society organizations, the community, to monitor the implementation of the preparation of that report? Because that's the specific moment where communities can come in and say, this is the report we are filing on the implementation of the Maputo Protocol. But on these aspects, still there's a gap. And if that is done, mostly it is done by national human rights institutions, whom I'm happy that we are also working with. The engagement of adolescents, the engagement of young people in that reporting arrangement is still not sufficient enough to make them bring out sufficient gaps within the implementation arrangement. And therefore, for us to have a meaningful implementation of these documents, first we must accept the realities. Yeah. That the communities we are living in are seriously struggling with these SRH issues. And also do a comparative analysis between those countries who have been implementing these regional commitments without reservations, the way SRH indicators appears in their countries, vis-a-vis countries implementing these regional commitments with reservations. The result will certainly tell whether we still need to have these reservations or we need to move forward. And taking an example of Rwanda, who have been currently one of the very performing EAC, EAC partner states in terms of improvement on SRH, it's because they have decided to manifest the true political will in implementation of the regional commitments. They have ratified, and then they have domesticated, and even their process, the reporting process, you'll really see the meaningful engagement of communities, the meaningful engagement of adolescents in the process, so that we don't report on their behalf. I know the duty bearers will be doing, and they might have a good report, but that report, if misses an angle from the communities, and here I'm referring to the young people, still the gaps won't be covered. So it is my take that if we are really to have a meaningful implementation of these regional policies, one, we must have a political will. Because ratifying so that we are in a good terms with other partner states is not enough. We should extend that will in the execution of these regional policies. Thank you.
Thank you very much. Thank you. Wellness check. Is everyone doing okay? Is everybody learning a lot from this panel today? Yeah, keep leaning in. This is a rare opportunity to be in such a setting, having very honest conversations with such a wide group of partners. We have one more round of questions before we then... Sorry, Baba Mali and Mama Mali are consulting. Give us like 13 seconds. Okay, thank you very much, Baba Mali. It's important that everyone fully understands this conversation. And so because we do have a Francophone ally in the room, we're making sure that they're seated next to somebody who can continue to keep them up to date on what the conversations are about. So thank you for that. And if anybody also needs any requests around translation, please make sure that you speak to one of the Rhnk people who are spread out around the conference room so that we make sure that you are capturing all of this information. And again, another 20 minutes or so before we come to some question and answers. Dr. Mohammed, as we alluded, that we'll be asking you, and we've heard a lot, even Dennis has just talked about what are the gaps in African countries' uptake to SRH. And, you know, he's mentioned one of the things is we need to have a reality check. We need to be honest with ourselves about the concerns and the gaps and the fact that we're probably not being, we're not confronting reality as we should. So I'd really like to ask you, there have been discussions in the adolescent policy on whether the youth who are sexually active should be allowed to access family planning services without parental consent. What are the main concerns fueling this discussion? What advice can you give? Contentious, raw, it's okay, that's why we're in the room. We'll figure it out together, okay?
We call it a political question. I think the audience can answer better than me. And Dr. Jean and Dr. Sarem, I was not expecting that question. But, you know, he said, there's the last point, he said, the community must be involved. I just want to ask the audience, with your permission, Janet, do they know the CPR prevalence of this country? That is the contraceptive prevalence rate in this country. Anyone who knows? You must not be from the health department. The CPR is what in this country? Total contraceptive prevalence rate is 57, average. CPR Mandera, ngapi? 2%. So if we say we give consent to Mandera, will they still achieve that? Dr. Serem? They will not achieve. So anyway, what I'm just saying is that this is a conversation for all of us. And it requires a conversation, a candid conversation. This is about sex. And when you're talking about sex, there's no fear, isn't it? We must all undress, isn't it? Lazima tukue uchi, si ndio? Si ndivyo? Hakuna kitu kingine? Daktari. For you to talk, you must be naked, si ndio? So some of these conversations are okay, we need to converse, we need to talk. But the thing is, we are guided by principles, we are guided by our constitutions, we are guided by our laws. And we are guided by the need and what our Kenyan citizens require. What we need to focus is mostly that we don't need to address the symptoms and the signs of a problem, but we need to address the causes of those problems, which is the prevention. Why should a child of 10 years get pregnant? Why should a child of 10 years be sexually active? I go to some countries, Dr. Jean is here as my witness, 9-year-old girl, incest, getting pregnant, delivering in our facilities. Whose failure is it? Is it the failure of contraceptive? Or is it the failure of the society? It is us to ask ourselves questions. How can we prevent those things not to happen? I think let's not just run with, just issues of saying this is the intervention, but address this from upstream. So that's my take. That's my take. In Kenya, the consent is 18 years. It is a constitutional. It's not something we can change at the moment. And that's it. But I think that's why we have this conference, for us to discuss. Yeah? Because the representatives who are in this forum are just one arm of the Kenyan or the citizen that we have. The other, once you meet them, also they have their own views. We work with the religious leaders. We work with the teachers. We work with schools. When you also listen to them, they have also their own views. But what I'm just saying in general is that there's a problem, and that problem is the symptoms of a problem up there. We must address that problem, which is prevention. And that's why in our AYSRH, the most important thing is about education, is about advocacy, is about awareness creation. Janet, I go to these universities, not people who need even a consent, but you find the universities, girls age 20, 23, 24, 25 are getting pregnant. It's not about the consent. It's about lack of information. It's lack of awareness. So the challenge is that we need to create that awareness. We need to train the parents. We need to train the teachers. We need to educate everybody on these matters. Mm-hmm. And one important point he raised, everything we do must be based on evidence. Without evidence, you are just working on emotions. Mm-hmm. So let's use the evidence to drive our agenda. For me, they may be personal views, but generally there is our constitutions, there are our laws, and there are our guiding principles, which I think are there, and which we must always adhere to those principles. But whether we should allow those concepts, I think, is a discussion for this conference. That's why we have this conference, so that people can tell us what the problem is about. We're here to listen. Okay. What are the challenges? What are the problems? For me, I always feel very ashamed when I see a girl of 9 years, 10 years, 11 years in one of our counties. I don't know how they get pregnant. I'm just even confused and that someone should just go and pregnant a girl of 9 years, 10 years. Prof. Mm-hmm. Yeah? So let's have these discussions. That's why we have this conference of 4 days, isn't it, Janet? Yeah. Yeah? But that's a political question. It's the audience to answer. Mine is just to say our consent is from 18 years and above. But the others, the services, the others who are below the 18 years, you go to some counties like Mandera I talked about. There are girls at 13 years, 14 years who are para 3. Yani they have 15 years, 16 years, they have 3 children. They're already adults. So are they, what do you call them? They're parents. According to them, they're not even children, they're adults. What do you call them? So anyway, this is a discussion that we're going to have in these 3-4 days. Let's discuss about it. The answer is with you. Please answer. Thank you very much.
Right. So I guess it's passed on for people to try and deliberate. There's definitely so many issues around teen pregnancy, social protection, violation. There's so many layers to it. And then also on the other side, contraceptives. So please, let's not leave the conference without having some kind of direction. We think we do need to start getting very honest with each other. Reality advises us right now that we can't keep normalizing the abnormal, and we can't keep putting our heads in the sand. We need to address some really tough issues. Felicity, age-appropriate sexuality education remains controversial in Africa. many countries shy away from enacting policies that promote it. We've already heard that coming out of this panel. So the final question for you today for this specific conversation is, can you highlight a specific country that has effectively used technology to improve SRH knowledge among young people, and what we can learn from that country?
Okay, that's an interesting question. Actually, several countries have, made significant strides in leveraging on technology to improve sexual and reproductive health outcomes. When it comes to sub-Sahara Africa, we have, many technological innovations, coming up. We have, I know about that of Love Matters in Nigeria and Kenya as well. Then I also know about MCNS in Mozambique. I also know about My Future Begins With You in Uganda. So these are like technological innovations that are coming up. But a country that really, that stood out for me when it comes to using technology, innovations to improve sexual and reproductive health is Rwanda. And just like Mr. Dennis said, that in Rwanda, they have really been receptive of ensuring that they implement political policies that addresses these challenges that we are facing. And for me, why Rwanda stands out is because when it comes to telemedicines and mobile platform usage, they have ensured that they integrate the telemedicines in their health system. So this means that even for young persons that are in the remote areas, they can receive consultations from their health service providers instead of going to the facility, because sometimes for we young persons, we find it hard to enter a hospital or a clinic and tell the healthcare provider that, oh, okay, I need a condom or I need this. That stigma, that fear of stigma and all. So this is what technology does. It helps to bridge that gap. It helps to address these challenges that young persons face every day. Then another area too that I think Rwanda has done very well, SMS and mobile apps. They have ensured that there is SMS that that when you test, you can easily get response. If you have any questions, you just send an SMS that is even free, right? This SMS ensures that when they send it, you can have information on these on topics like HIV, STIs, and all of that. Then also when it comes to community health workers and training, they have also ensured that they train community health workers in rural areas and also equip them with mobile devices. This helps these health workers, to track. It also helps them in terms of their reporting, real-time reporting, right? So this is really effective when it comes to ensuring resource allocation and also reporting, even funding allocations. So this is what we are talking about, that data is very important. And also, when it comes to digital health records, they've also ensured that they implemented the electronic records. So last week, I was having a conversation with some young persons, some of the delegates from the Africa CDC during the last conference that we had, the public health conference. So the conversation was also about technology. They were like, these young persons were like, we need to visit Rwanda. We need to learn from them, that these guys need to teach us how are they doing it, right? So this is why we are using, or I'm using Rwanda as an example. They've really been doing a lot. And this wouldn't have possible if there's no political will, just like you said, Mr. Dennis, earlier. That when there's political commitment, when we have a strategic partnership, it ensures that these technological innovations are there, and it will help us to address these challenges. Because why some other countries in the West have have gone far ahead of us is because we are not being receptive of this. So we need to prioritize technology so that it can help us to address these challenges. Another point too I would like to emphasize on is the importance of public-private partnership. So earlier on, one of the speakers mentioned about using or leveraging a multi-sectoral approach. I think that is where, for us in Nigeria, that is the area that we are currently, pilot. We are ensuring that we are, bringing together, working with other private sectors, the NGOs, the CSOs, the youth, collaboratively. Because what we do most times is we like working in silos. But when you work together with other organizations, with other actors, it helps you to achieve more results. So this is also what Rwanda have done, the public partnership, the public-private sector partnership. They've really done that, and it has really helped them as well. So if we are able to learn these lessons from Rwanda, as Kenya as a country, as Nigeria and other African countries, it really helps us to address these sexual and reproductive health issues, especially when it comes to young persons. Thank you.
Thank you very much for that, Felicity. Yasmin, the next question for you is, what are the most significant cultural and systemic barriers to expanding access to AYSRHR for young girls and adolescents, and how can we effectively influence system parameters and collaborate with local communities to overcome these challenges?
So I think my esteemed colleagues, Dr. Sheikh and Felicity, have actually mentioned some of the biggest cultural barriers. And so I may not talk so much about those, just to say I want to emphasize the key points that both of them have made, which is that, and I think that Galian made, when we look at cultural barriers, we can't look at one sector. This has got to cut across all sectors. It's got to be an overall government approach and an open conversation, as Dr. Sheikh said, because, the church and the Muslim, all the religious leaders, the educators, the health, every aspect has got to come together in this discussion to truly, as Felicity is saying, we can't address some of these barriers just through one sector. It's got to be a consultative discussion. Everyone has got to get to the point and realize that this is critical for us to move forward as a country. This is, ensuring the safety and well-being of these girls and adolescents. That is central to our ability to move forward. And what does each player and important stakeholder bring to the table as part of the solution? How do we come up with a solution that accommodates, culture is important and religion is so important, but so are these young girls' lives. How do we bring those together in a solution where we move together? From a systems perspective, so maybe I'll just move on to the systems. I've looked at the program, and it's a really rich program. There is so much evidence and data about some of the work that has been doing that will address some of these cultural issues. But when I come to the system perspective, I think, again, I may sound like I'm repeating myself, but I would say we need to narrow the gap between the policy and the action and our ability to move things forward. So, for example, sometimes we have really great policies. We have self-care guidelines and reproductive health guidelines. How do we make sure those are well disseminated? I think one of the earlier speakers talked about the reintegration of young girls after pregnancy into the school system. But many teachers are not, or educators, are either not aware of this policy or they're not on board. Then these girls are left behind. How do we make sure that all of our great policies and guidelines reach the farthest corner so that we are implementing and operationalizing some of the things we've said are important to us as a country? And it means that all of us have got to be part of that action. It can't be left to a few key, the ministry is leading the way, but each implementer, I think, has got to help and step up across sectors and say, how do we implement these policies? So, because that is a really important part. So getting the information out there so that you remove some of these barriers is really important. And then I'll come back to what I said before, which is all the information in the world is really important, but it's not enough without access channels and supplies. If a girl or a woman needs to protect herself from an unwanted pregnancy, she wants to plan her future, she wants to stay in school, she needs access to a modern contraceptive method, which means supply chains need to work. We need financing for these supplies, both from the public sector and from the private sector. Because without a strong supply chain that delivers whatever method, the whole range of methods, to wherever these women and girls need them consistently, we're not going to be able to achieve those goals. We're not going to be able to move 57% MCPR to a higher level, especially in Mandera and Wajir, that face so many barriers. We're not going to be able to move from 2% and 4%, even when we're able to make progress on the cultural issues. If we don't also think of the systemic barriers, we're not going to be able to move the needle on some of those numbers. And so I come again back to the idea that we need methods that reflect what these girls and women need. It can't just be one method available and that's the only choice they have, because they may not choose that method. And then we also need, so we need self-care. We need, in the pipeline there are biodegradable implants. There are men-controlled method, because men are just an important part of the equation for us in the future. So we need all these methods available, and we need more channels. Let's look across the sectors and say, how can communities play a role? How can pharmacies play a role? And what is the role, the existing continuing role of the public sector? Thank you.
Thank you, Yasmin. All hands on deck, essentially, just ensuring that we're all included. Two more questions to our panelists, and then we'll have a few from around the room. Gadian, how can countries effectively involve young people in developing policies and designing SRHR programs and services so that the policies, programs, and services meet the expectations of young people? I know, again, quite a number of the panelists have touched on this, but your thoughts on it?
Thank you very much. Well, involving young people is about this motto, you know, nothing about us without us. I mean, I cannot say that anymore because I'm not young anymore, so it's nothing about them without them. But basically, in order to be able to do that, we as a society first need to accept something that I think everybody agrees here with, but is not so obvious in certain places, is that basically young people are sexually active. And that they have specific SRHR needs. We can't expect a young girl, 13, 14 years old, to care about family planning. She shouldn't be thinking about putting together a family. She should be thinking about, you know, being a girl of her age and eventually experiencing and discovering. She should be thinking about pleasure. But these terminologies, these words are taboo in many of our contexts and do not enable the involvement, the real involvement of young people when it's about SRHR and their SRHR. Secondly, an important thing, you cannot design policies and programs if you don't have solid data. I know several panelists have touched upon it already. So where do we collect it? We can collect it from health institutions, from education facilities, but how do we make sure that young people are empowered to provide this information? That they have the right words, the right vocabulary to speak about their SRHR needs. So we need CSE, we need safe spaces where they can discuss and learn about their sexual and reproductive health and rights and needs. What else can we do to integrate them and to include them? A simple thing is establishing youth advisory boards at the local, regional, and national level, including them in participatory budgeting. It's important that they have a word, a say, in where the money about SRHR, youth SRHR needs goes to. So this is also something important and can be done at the governmental level, but also at the level of our organizations. I know Rhnk, I know IPPF member associations have young people in their boards, and they have a word, they have a say in where the budget goes and how money for SRHR of young people goes to. It's important to create feedback mechanisms where they can, regularly provide feedback so that it's always, the data is accurate and regular. We can integrate them also through peer-to-peer programs. We've seen that this has been quite highly effective. Many of our IPPF member associations have programs around peer-to-peer because it's great to have young people speak to other young people about their SRHR needs. Of course, leveraging social media platforms. This is where young people today look for information, and it is also where they share about their needs, their problems, their issues, because of the confidentiality issue and the fact that you can maybe hide behind a pseudo. So this is a very effective tool, online social media campaigns, organizing webinars online and campaigns. And finally, I think an important point, if we want to really include young people and enable them to be really proactive in designing these policies and these programs, is training and capacity building. We need to train and mentor young people, allow them to access, workshops, leadership training programs, so that they can really develop their capacity and their voice. Thanks.
Thank you very much for that, Galyan. And finally, Dennis, what social accountability mechanisms work in holding governments accountable to realize AYSRHR gains for young people?
Thank you so much. Speaking of social accountability mechanisms, there are so many of accountability mechanisms. But I'll address few, and then at the end, even those social accountability mechanisms also has a problem. One, I'm happy that you have mentioned a participatory budgeting process, which is very key. When we're speaking of Ministry of Health budget, for instance, for this year, how many young people have been involved in that process? Normally you find politicians from their diversity taking and writing the agenda, and then young people are left behind. So it's high time that we have a mechanism that will ensure serious and effective engagement of young people in the budgeting process. But not ending at the budgeting process alone, also having a budget tracking mechanism so that at some point in time we are able to measure and see what was allocated for Ministry of Health. Was it cascaded down to the actually planned interventions? If we said this should go for commodities at the facility, are we able to see those commodities at the facility? So we should be able to track the budget, because passing the budget is one thing, but disbursement is another thing. So when we have a budget tracking system, we'll help the young people to really hold their governments accountable. But again, speaking of feedback mechanism, do we have a youth-led community, youth-led monitoring systems? I heard, and I'm very happy that we have been informed that almost 60% of facilities in Kenya are providing adolescent-friendly health services. And that is coming from the government, and we're happy for that. It's an achievement. But are young people also able to attest to that? They will lack responses because there is no mechanism that is helping them to trace this and have them on record. We have no scorecards, and if we have, they are not led by young people. And the community monitoring system that will bring youth people to a conclusion that what we agreed during the budget process is completely different to what we are seeing. Who is measuring whether this is a youth-friendly health service or not? We need to come to a point where we also have a feedback from the beneficiaries, the young people. We might consider them youth-friendly, but from the youth perspective, they become not. So we should have these two ways mechanism, at least to assist in the accountability mechanism. But again, include young people in various technical working groups. I know there are a lot of Ministry of Health working groups and their community representatives. But these community representatives sometimes are not young people as well. So you discuss youth, adolescents, related SRH interventions with the community representative who is not an adolescent. And therefore, you'll find a lot of resolutions made without meaningful inclusion of adolescents. So when we are considering this, we should not say community engaged on this. We have to assess if it is on SRH, on adolescents, were adolescents present in the room? And not only being present in the room, were they capacitated prior to that so that they have meaningful involvement in that? But again, this meaningful engagement of adolescent and young people is facing a very serious problem that I would wish to share with my colleagues as well. There's this challenge of funding to the youth-led organizations. So we want young people to be in a position of holding the governments accountable, yet when they ask for those finances to facilitate their processes, we put a lot of barriers. We ask them of 10 years audited reports, we ask them on several policies, We ask them the issues of capacity and all that. If we are not giving them finances to build their capacity, how then are we expecting them to hold our governments accountable? So it's high time for funders, for program designers to take into account the priorities of young people by bringing them on board, but also by giving them finances. If you tell me to give you 10 years audited report, the other donor comes asking me 10 years audited report. Who will give me so that I have the first audited report? So it's very key. When we want young people to stand for what matters for them, we must be in a position to support all these initiatives so that they hold governments accountable. Thank you.
Thank you. Obviously, a lot of people resonating with that, right? The action steps that are needed. Everything we've said here, it's all great, but can we start with trusting young voices and integrating them? Thank you so much. We have room for a few questions. 1, 2, 3. We don't want to get, oh wow. Y'all are going to be here for 4 days though. So if you're not able to ask all the questions today, please, let's make sure that we take advantage. So the first 3 people, I think we have her. I don't know whether we need a microphone to go around. Okay, 1, 2, 3, 4. We'll start with that round of 4. I'm so yeah, could you stand? You, yes, stand. Oh, yeah, no, stand. Yes, so 1, 2, 3, and we also need somebody from that other side of the room. Okay, please, the rules for the Q&A, please, 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 in the interest of time, your name, where you're from, who you're directing the question to, please keep it very, very brief if you can. Over to you, thank you.
Thank you very much. My name is Kola Kalia from Faith to Action Network. My question goes to Dr. Mohammed. I would want to know the government's position on the implementation of comprehensive sexuality education. And now that you mentioned that one of the challenges is teenage pregnancies and all those other challenges, what is the government's position?
Thank you very much. You can sit. There's a lady behind you.
Yes.
Oh.
My name is Haman Salim Ribulele from Western Cluster. That's Kakamega. I one time participated in a program called Health Choices for a Better Future. And this program lies within the NASCOP. This question is directed to Dr. Mohammed. This program between 10 years to 14 years, these are the people who are supposed to be engaged in terms of early pregnancies and in terms of prevention, because you really stressed about prevention. Now here, the program was implemented by one time AMBATH program as an NGO, but we reached a snag because Minister of Education and Minister of Health could not agree. Because Minister of Health officials, when they approach the students, they are in school already. So they need a directive from Minister of Education. So this program failed flat. And this is where the prevention comes in. Thank you.
Thank you. There's a lady behind there. Yep.
Thank you. My name is Gilo Fugichi from Marsabit County, and my question goes to Dr. Sheikh Mohammed. How is the government addressing the impact of climate change on health infrastructure and service delivery, especially in ASAL region?
Thank you. We'll do another quick round. I think there's a gentleman here who's been standing, and we need, I'm so sorry, we won't be able to pick everyone, ladies and gentlemen. We'll pick one person from this row, the lady with glasses. Yes, you. And then one other person from that row. Then we'll take it from there. Can we start with you?
Yeah, good afternoon. My name is Hambule Mohammed. I work for the Ministry of Health at the Division of Reproductive Health and Reproductive and Maternal Health. My question is generally to all the panelists and to the conference. We are talking about AYSRH, and to me the feeling has been AYSRH is equal to the girl. Where is the boy? Thank you very much.
Okay. Can we please have a few other younger voices as well so that we can hear? There's a lady in a strapped top there. Oh, okay, the microphone has been passed. My apologies. Okay.
Yes. Good evening, everyone. My name is Irene Golo, and I work for Cheshire Disability Services, Kenya. When we talk about adolescents and youths, SRHR, and now to look at the intersectionality bit of it, you know, we don't have to really forget about the issue of disability. Now, we are talking about adolescents and youths, SRHR. When it comes to disability, we really need to look at the policies and structures in place and also amend the already policies that are in place. We have youths with disabilities who at times their ages are misunderstood due to delayed milestones, and at times they fall as the prey of SRHR issues due to lack of access to information and also clear referral pathways. How do we integrate disability inclusion to ensure that even the adolescents and young persons with disabilities are able to enjoy these and also get to know access to their rights and information? We should not really just live and also matters of inclusion in this aspect.
Thank you. We're going to do an answer round from those questions so far, please. And then I'll kindly ask the RHNK team to identify another set of our last 3 questions, preferably from each row. I don't know how you'll do that map. But right now, I'd like to invite our panelists to at least address those initial questions just in the interest of time. So I know Dr. Mohammed had a bulk of them. And perhaps we can also open it up to the other panelists on integration of men and boys, which I feel has kind of been touched on, maybe not directly, but I do believe it's always a part of the core discussion. So if anyone would like to talk about the integration of men and boys, climate integration and disability integration, before we then invite Dr. Mohammed to speak specifically to the government questions, and then we'll do a final round of questions. So I'll have to just come over and hand over my mic. I don't know if you have any with you right now. No? Anyone wants to talk about? Okay. Okay, yeah.
I can go quickly and
yeah, sure.
colleagues
Please
can
do.
complement. But just to say, yes, when I was touching upon the integration of young people in SRHR, it was involving, it was young people in all their diversity. So including, of course, young people with disability. I mentioned, young mothers or girls with from poor or single-headed households. We need to include all the diversities into the policies. And what is essential is not to approach this from an equality perspective, but from an equity perspective. So specific young people have specific SRHR needs, and we need to take this into consideration. And when I say we, it's country, the government, but also NGOs. When in our programs, in our projects, this means making sure that their voices are also heard. So we also need to make sure that and create spaces for these young people to be heard. And this also includes boys. Although for boys, I would have more to say. I don't know if but I don't want to take all the floor, so maybe I can pass on to someone else.
Okay. Anybody else want to speak to either the integration of boys or disability, although Galian has talked about the disability as well? Yasmin?
I'll keep it brief. And Hambule, thank you so much for the question. I think just to say, as we were talking about channels, one of the things we are trying to do as we expand family planning access to pharmacy channels is to think about the quality of service provision by pharmacy providers, and think of it holistically. So not only focused on young girls and women, but acknowledging that many times through the pharmacy channel, it's men and boys that come in and also purchase the contraception, whatever, for their partners. So it's really acknowledging, and we didn't have time to talk about it, but male involvement is critical. It's a key part of the solution we have to think about, and listening to boys' voices as well, men's voices, and empowering them within the culture to support this idea of agency of girls and themselves as young men who are sexually active. Thank you.
Okay, thank you. Did you want to mention something, Felicity? Briefly?
Yes, I just want to say that I think before, just like the person that asked the question, so before there's always this, this thing of young boys should not know what is happening in terms of talking about SRHR topics and all, but currently, that is changing. That narrative is changing. I take, for example, in Nigeria, so part of the programs that we are doing, we're ensuring that partners, NGOs are being intentional about also, coming up with programs that includes or that engages men and boys. No longer just the girls also, because that is very important. In the schools, when you are talking about sexuality education, before it used to be the boys should go out, the girls stay, let's talk about puberty, or let's talk about menstruation also. But now, that narrative is changing. So I also think that as partners, as NGOs, and as CSOs and all, we need to be very intentional about engaging men and boys. Thank you.
Thank you, Felicity. A final quick comment from Dennis before we hear from Dr. Mohammed and Dr. Serem, who also has a mic with him. Dennis, your thoughts?
Thank you. I like the challenge because it's very honest that the feeling for so many people is like adolescent sexual reproductive health is all about adolescent girls and tending to leave out the men, the boys. But it even goes beyond that because I was interacting with some young people some other times back, and they were telling me these teenage pregnancies are not even as a result of sexual intercourse between adolescents themselves. It's a result of someone elderly somewhere and some adults with the young girls. And they claim them to be, for lack of better words, they claim the young girls to be kind of sweetie as opposed to, and that has caused the feeling that we observe it as an adolescent's issue, but it goes beyond that. And that's why Rhnk has extended invitations even to some adults in the room, so that when we are addressing teenage pregnancies, they are also part of the solution. Yeah, so they take part of that. But again, on the issue of climate change with SRH, yes, I affirm it's very important, and it is an aspect that needs a very serious observation, because the issues of drought, issues of floods cause a very serious challenge to adolescents, and specifically to girls. We are saying specifically to girls based on our social settings, where young girls are charged with so many responsibilities. In that circumstance, in a places faced with the droughts, places faced with floods, it's very possible to find a young girl exchanging sex with something cash to earn a way of living, also securing other basic needs. So it's high time that we integrate climate change into SRH interventions. Thank you.
Thank you very much. We'll now invite the government for the remarks, for the questions that were asked. And as we hear from the government, please note there are breakout sessions the entire week that will cover some of these areas. So please look at your programs to make sure that if you're not able to raise your questions today, you will be able to attend the session that has your specific question. Dr. Serem.
Thank you very much. Yes, there are some questions which have been addressed to Dr. Mohammed, but I think they were mine. So that's why I've risen up to answer those questions. Yes, there was an issue on comprehensive sexual education, and you know, as a government of Kenya, the government is not a monster. It listens to what the people want. And in our situations, of course, we adopted human sexuality. And in our country, for your information, we've come up with a booklet called Understanding Adolescence, which is accepted by everybody, the Ministry of Education, religious persons, and that one is being rolled out, implemented in schools across the country. That is primary and secondary. Secondly, remember, and I want to talk for Kenya, the government of the day emphasizes more on primary health care, which is more of preventive. When we talk about issues of pregnancy, can pregnancy be prevented? Yes. Can HIV be prevented? Yes. Can abortion be prevented? Yes. So the issue is, as we address those challenges we are already in our hands, we should be focusing more and investing more on prevention. And when we look at the strategies which are there for prevention of all these bad health indicators, then there are several, and there are quite a number. And they are all ask a lot of fruits, and they have an impact. I think that is where we should be going. Thank you very much.
Thank you. Okay. We have one more round of questions. I hope the RHNK team has helped me identify. Once again, please note we will not be able to take all the questions. Oh, you need a microphone. Okay. I'm really trying to keep this as fair as possible. So far we have, oh, there you go. You have one? Okay, go ahead. And then we'll go to the gentleman behind
me.
My
name is Michelle Karaoke. I'm from RHNK. So my first part of my question goes to the government. The other part goes to all our panelists. So with the issue of having a youth center, like a place where we are getting services, as a youth peer provider, the highest percentage of facilities that are providing services that are youth-centered are led by organizations. If you refer young people to the government facility, they are not able to receive these services they need. Commodities are not there. The other part is I would like to hear about the intersectionality of AYSRHR and mental health. Yeah.
Thank you. We have a gentleman here.
Good afternoon. My name is Jobin Skalui. I work for Kibos Sugar.
Please raise your voice a bit more.
My name is Jobin Skalui. I work for Kibos Sugar. I'm an SRHR champion. So my question is, you know, we have always been talking about culture is not good. We have some cultural practices that are not working. But we have some other cultures that work. Because when I was growing up, it's only my uncle or my aunt could talk to me on issues to do with the SRHR. My parents can't do that. But right now, many people don't even know who their uncles are. They don't even know their aunts. It is just your father and your kids and all that. What is the government or what are the institutions doing so that we bring in some good cultures that we are trying to fade away with them? Because we as parents, we may not talk to our kids exactly what is happening.
Thank you.
Okay. This Lucy from Busia. Okay. Hello. Okay, this question goes to the World Health Organization and MOH. You find that we have guidelines to take care of antenatal care. Even we motivate them to come to the clinic and deliver in a hospital. During postnatal care, we give them a schedule, monitor them very well, we give motivation. When you come to the child welfare clinic, we also give a schedule, give some motivation, and our services. Now we come to the preconception care. The care of a child, adolescents, from 6 years to 18. It's never captured. There's no budget for a youth and adolescents. So, what are we going to do? The MOH, are we able to create a guideline, schedule visits, give motivation, and give a human resource to take care of these youths and adolescents so that we don't lose them from 6 years to 8 years? Where we get in contact with these children is only when they get pregnant, when they get STIs. When we have problems is when they come to the hospital. Please, the MOH, can you create guidelines so that we take care of these children, so that we don't lose them? Thank you.
Thank you. We can only take another final question because we should be leaving here in about 10 to 12 minutes. So if we can have one more question. Oh my gosh. Is the microphone? Oh, okay.
Yes.
Oh.
Hello. Thank you very much. Thank you very much. I'm Emmanuel Kiptong Olepus from West Pokot County, and my question will go to the Ministry of Health. It's about vaccine shortage. We have witnessed vaccine shortages across our country, and it's very basic when it comes to controlling major diseases such as polio and tuberculosis. So what's our government doing to ensure that the supplies are back? Because, you know, it's very critical when it comes to marginalized pastoralist counties. Then it was a great comment to hear from Mr. Serem that the government hears from the people. But with the current finance bill, we have seen with the current finance bill, we have witnessed some taxes on basic product and commodities, such as sanitary towels. So, is this the same government that is beating peaceful protesters in Nairobi that is also listening to its people? That's the big question.
Okay, I think that is the best place to end the questions for today. Thank you, sir. We're going to do another round of answers. Good luck to the government with that last one. And then honestly, for the rest of you, please note you can talk to our panelists and look at other panels for the conversations we can have. Dr. Serem.
Thank you very much. I think I should have been here. Yes. But only Nola I'm here. Yes, concerning, in our country, in Kenya, we have what we call public-private partnership. And if you have had a chance to look at our last census on the health facilities, we have almost like 50-50. About 6,000 level 1, about 1,000 level 3, and they are both private and public. So we are in partnership. Some of the services is more offered in public. Some of the services is more offered in private. So, and the government of Kenya supports private in very many ways. That is given. So we're in a collaboration. Concerning the mental health, of course, we've incorporated. Mental health is now coming up as a big challenge in our country. And in the continuum of care, the antenatal care, we've incorporated guidelines on mental health, which also includes services for adolescents, because we have realized that was a gap. So that is already happening. We're already developing parental and guardian guide to guide the parents. We also realized there was also another gap, that parents don't know how to counsel their children, their adolescents. So that guide is in its final stages, and it will be rolled out. We hear you about teenage pregnancy antenatal care. Of course, when a teenage gets pregnancy, they are not discriminated. They are offered the services. Just like when a girl has an abortion, they are not discriminated. And that is why we've improved on the guidelines and improved on the health services to offer post-abortal care. On the issues of vaccines, I think that one has been addressed. And with the other thing, I don't know, maybe my colleagues will help me if I've missed something. Thank you very much. I can stay with the mic.
Okay, thank you. We can have final quick remarks from the panelists, again, from some of the questions or any closing remarks. I know we have about 7 to so minutes, so we can start with Dr. Mohammed Sheikh.
So mine is, I know the questions mostly were to MOH, and Dr. Serem has answered them very well. But I want to speak to the youth If you are a Kenyan, just raise your hand. Kenya, today, we got independence in 1963. So today what is the age of our country? From 1963, how old? 60 what? 61 years. By 2063, we'll be celebrating 100 years. In every generation or in each country or in every country just mentioned, because many times we refer ourselves, we want to become like the Asian tigers. It was the gentleman there, he talked about the taxes and why we're doing that, all those. It's because if you want to become like the Asian tigers, like Singapore, Malaysia, and the rest, there is something that you need to do right now. As I told you, we are at a stage where our country is what we call the population transition from child-based, youth, and one time, right now as we speak, our average age is between 19 and 20. Japan, the average age is 40 and above. One time, this country will reach that where Japan is. That may be 50 years, 70 years, or 100 years. So there's something they did, the Asian tigers, what we call accelerated economic development. They sacrificed in a short period, and right now they're enjoying what they did in that short period. If you are aged 70 years in Japan today, I'm talking to the youth. You may not like it. You may not like it. Wait. I have the mic and I have.
Let him finish the statement. I know this is hard to listen to, but let's finish the statement.
Just listen. That for us to move to that level where we want, for us to accelerate. Some of you came with a plane from Nairobi. When the plane is taking, it takes a lot of energy, compassion. But when you are 37 feet, you go. So what I'm just saying is that for the youth, this is the time to sacrifice for our country. So, yes.
Okay.
All right. You don't like that? I will hand over. But the issue is to do with the ASALs. A lady asked about the ASALs. In the ASALs, it's either a drought or it is flood. And in all those periods, issues to do with gender-based violence, child marriage is very common. So I think for the organizations which are here, it is important to give priorities to the ASALs region. Specifically, there are some things that we have taken it for granted, and that's cultural things that are sometimes hindering the development of the girls in those regions. So it's important at least you prioritize. But for the use of this country, as we prioritize for AYSRH, let's prioritize for our country development so that one day we can say we are a Singapore of Africa. Thank you very much.
Okay. Do we have any quick closing remarks from our panelists? Maybe also leave the room feeling some hope that's needed right now. Very quick closing remarks. Just sort of like a one-off call to action or closing remark that you'd like to make. Felicity, then we'll go to the rest of the panelists.
Okay, thank you so much. I really enjoyed this panel. Just to conclude, I'm going to be speaking to my fellow young persons. So the truth is, not every time we're saying, oh, a young person should be there, a young person should be included, a young person should, represent. But again, we've also noticed that if young persons are on the table, they're just there. A young person is there. But what are you doing? Are you making a difference? So I just want to charge my fellow young persons. Please, don't just be on the table. Also own it. Own the table. Please, represent wherever you are. Speak. You have the power to make that change. Keep on talking. Keep on advocating. The change will come. Thank you.
Thank you. Thank you, Felicity. Yasmin.
I'll do a call to action. And thank you, everyone, for the great comments, the participation. This is a complex issue, and we can only move forward if we raise all the voices. My call to action would be, please let's move to action. Let's add information, let's add stronger systems, and let's translate that policy into actual activities and actions that will help us make a difference. Because I think the purpose of this 4 days is to move us forward as a community and change some of the results and outcomes that we're talking about. Thank you.
Thank you very much, Kalyan.
Thank you very much. So mine will be maybe a reflection coming from one of the questions, about what about boys and men? And as much as I think it's essential, and I want to highlight essential, to involve men and boys into SRHR planning, design, to make sure that they get the right information, the right services, I think we must not forget why we focus on girls. There is a reason for that, because whenever a teenage girl gets pregnant, she is the one who is going to bear the consequences of that. She's the one who is eventually going to risk her life into getting an abortion and maybe die from it in countries where it's forbidden. She is the one who might not be able to go back to school. She is the one who will end up, a single-headed household in most cases. So I just wanted for us to keep that in mind. There is a reason why we put emphasis on girls. Thanks.
Thank you. And Dennis, before we hear from you, we will be hearing from an adolescent girl very shortly, very, very shortly after this panel. So thank you, Dennis.
Thank you so much. It has been all well. And for time purposes, I think let's meet on 19th on the side session organized by Faith to Action, where religious leaders will be testifying on their contribution to advance adolescent sexual and reproductive health and rights. And also we'll be having a very serious discussions on 20th, where Yanaso will be having a side session on adolescent sexual and reproductive health. So let's meet there so that we further these discussions. My parting shot to RHNK, it has been one of the very well organized conferences, and I think when we'll be celebrating 10th scientific conference, probably it won't be RHNK, it might be Reproductive Health Network of Africa. Yeah. My parting shot to every participant, think of when you had your sexual debate, how old were you? And that's what's still happening on the ground there. So let's join forces to rescue our colleagues. Thank you so much.
Thank you. A round of applause to our panelists. We have Dennis Bwana, who has just given the parting shot. Galian Pahaye, Deputy Director at IPPF Africa Region. Dennis is SRHR Program Officer, Eastern African National Networks of AIDS and Health Service Organizations. Yasmin Chandani, CEO in Supply Health. Felicity Noma, Youth Focal Point, FP 2030 Nigeria. Dr. Mohammed Sheikh, Director General, National Council for Population and Development, Kenya. So let's appreciate them. I know that so many people were not able to ask their questions. I also know, as a Kenyan, I also sense these frustrations. I think that may sound very off, but I'm being honest. I also talked about the protest today on my social media because in my DNA, I know that advocacy and activism are important. So we hear the frustrations, and I think you need to know that it even goes beyond this room. It's national. I do know the government is here, and I'm really hoping that it's something that you'll be able to integrate more in your messaging. It's for people to feel seen and heard. We still appreciate your presence in this conference. We also hope that young people and all of us can really leave this conference feeling seen and heard. Because for a while, I think a lot of people have not been feeling seen and heard. And that echoes in the comments that are coming up, in the remarks that are coming up. It can be hard. This is about tough conversations. Let's not be afraid to have them. Let's just continue to find a way for people to be seen and heard and to find safe spaces that can happen. So thank you very much, RHNK, for being able to convene all these stakeholders in this room. Thank you to our panelists. Thank you to our participants. I would now, I don't know if Baba Mali has gone. Hi, Baba Mali.
I'm here.
I would like now to invite our panelists to return to their seats as I invite Baba Mali to now come and take over for this section of the program. Asante sana.
Before they
we need a
leave.
picture. Sorry, we need a picture of the panelists.
And we need 2 pictures, one for all the panelists, and another special one for the 4 ladies looking lovely in those prints.
Oh, okay.
Yeah.
Am I allowed in this picture?
Of course.
I'm forcing, even you come. Please bear with us for 2 minutes as we do a very quick group photo before Baba Mali takes over. Can we have a quick one of some of the speakers today? Nelly, please join us. We are Jean. We can also bring Prof into this one. Please, come. Okay, Laurie, Salima, and Evelyn. Yes, please come. Again, bear with us, just a minute or 2 for the photo op. Media, once you're done, please motion us. Thank you. Thank you very much, everyone. Please return to your seats. Thank you.
Wow. So, one of the benefits of drinking water is to cool down the body temperature. So please, can you take some water? Where's your water? Can I see your water? Where's your water? Can I see your water? Bottle of water? And there's more at the back. So let's have a sip of water. Water? There's some more at the back. So if you have your bottle of water, cool down. Please hydrate. Please hydrate. Please hydrate. Kuna maji, please help with the bottles of water. Please hydrate. One of the functions of water in biology is to cool down the body temperature. Ha! Do you understand what I'm saying? Good. And one of the functions of water in Nairobi is, do not quote me, eh? But one of the guys from X always says, things are boiling nicely, just like the doctor ordered. And we shall be there no matter what. Anyway, what are we saying? Let's thank you, Mama Mali. A round of applause for Mama Mali. Experts, moderator. So thank you for setting the tone and the pace and the momentum for the week. We now need to hear from an adolescent. So Lauren Hill. Is she around? Lauren Hill. Lauren Hill? Oh, is that you? I was looking at the back, I don't know why. Oh, are those your friends? Lauren? Lauren's friends? So, Lauren, before you talk to us, you need to tell us if your name is inspired by the singer Lauren Hill.
Yeah, it is.
Wow.
My eldest sister was really a fan of Lauryn Hill.
Wow, I am a fan. of Lauryn Hill, that one, and this one. Talk to us.
Ladies and gentlemen, good afternoon. Kizungu imekuwa mingi leo. Anyway, so I'll start with the short story. I'm Lauryn, a girl from Kibera slums. I gave birth at the age of 16 years. Living in Kibera is such a tough challenge because I really had a challenge with accessing information on AYSRHR. Just a moment.
Round of applause for Lauryn Hill.
Okay, sorry for the inconvenience. So, being brought up in Kibera, living in a single room with my parents, it was really a tough lifestyle because now you can imagine living with your mother, your father, your siblings in one single room. And in an African household, you are not allowed to talk. All you do is respect whatever your parents say. Is that true? So my elder siblings did not manage to make it in completing their studies. And I was the only one who was almost making it in breaking the generational curse of not completing my studies. But unfortunately, I became a disappointment to them by getting pregnant at 17 years old. And now, it was really a challenge to them because I was the hope. Mimi ndo nilikuwa tegemeo lao. They had so much hope in me to raise that family, but unfortunately, I got pregnant. I really had a hard time because I had no one to talk to. Who am I going to? I got pregnant at the age of 16. That means I have to drop out of school because now your parents will not be able to pay your school fees and also take care of the extra mouth you're bringing into the family, you know? So it is really hard. And now I got depressed. And when I got depressed, I started causing harm to myself, you know? So this harm was I would isolate myself. And you know, that is really dangerous for a pregnant person. I would isolate myself. I tried, if you Kenyans unajua mwarubaini, I had a myth that mwarubaini assists in abortion. So then I tried to do this, but unfortunately it didn't work. So now I was really stressed because I didn't know what to do with my life. I was the only hope to my family, the only hope to my parents, but I've gotten pregnant at 16 years. But luckily, when I was at my downest moment, I was able to meet this organization that really showed me that there is a hope after me getting pregnant as an adolescent girl. And it also showed me that there is hope for other girls to make it, even after failing the community, failing your parents, because now everyone is like, huyu ashapata mimba. What benefit does he have to this community? And you know, so Chika really encouraged me and they walked me through this path. That is why I always say, the only limit to our realization of tomorrow will be our doubts of today. This is not only a motivational quote, but ni ile kitu naambia mayouth. Zile fears na doubts mko nazo, mkianza kuzi overcome right now, the brighter your future will be. And again, growing up in the community, I've seen that the AYSRHR challenges that we adolescent girls and youth face is, first of all, it's, the panel here has talked about youth-friendly policies. They've said that there's a 60% the government has enrolled for youth, but actually, situation kwa ground ni tofauti. When you go to these public clinics, you'll be, for real, if I take someone, we walk with you to the public clinics, you'll be able to see that there are no youth-friendly services. Because one, first of all, in these public clinics, all you have is, sorry to say this, but most of the people working there are elderly women. And as a youth, you are afraid of having to start a conversation with her because you are viewing her as your mother. You can't be open with them. So when the government says they have put in youth-friendly policies, how have they put in? As a youth, I would find it better, as Felicity from Nigeria said, we should use technology. Sisi ni Gen Zs. Technology will be better in advancing youth-friendly policies because as youths and adolescents, we find that our generation of now, most people are really drawn to their phones, computers, and laptops. So if we have apps and a lot of websites whereby I don't have to visit a public clinic or any other place to be able to access information, I can access it through my phone. So I will feel better if the government could really put more effort in technology-wise, not only physical, because a lot of people really face stigma with that. And also, I find it that youths go through a lot of mental health, and nobody is ready to speak about that, because now the issues that come from mental health are related to societal acceptances. As my case, I didn't have anybody to talk to. I didn't have anybody to guide me. That is before I met Tika. I didn't have anybody to tell me that you've gotten pregnant. This is not the end of life. This is what you can do. So as much as we are trying to put the youth-friendly services, can we try and have also mental health services there so that our youth can be able to access more information? Another pain point that I've seen also as a youth is that we really have a challenge in accessing contraceptives. Because now when you visit these public health facilities, you will find that unaenda unaambiwa we are out of stock with the contraceptives. And the only option you have is to try and visit a private clinic. And how will that young girl who has already given birth from the slum get the money to access that contraceptive from a private clinic? Because now you already have the challenge of feeding that baby. Your parents don't have a formal income. You're living in the slums. So I would really like for the government to provide free contraceptives and reproductive health services. And another thing, as much as we sit here and talk, and we are not letting the youth being involved in their decisions making, there's nothing we can do with that. When we empower the youth, you empower the future. So I would really find it as a solution if we really listen to the voices of the youths and we also empower the initiatives that are being brought up by the youth. Let us have forums with these people from the slums, the youth from humble backgrounds, because these are the high percentage of people who are really being affected by AYSRHR issues. And lastly, but not least, as a girl from Kibera slums, I wouldn't love to see other girls go through what I went through because they are lacking information on AYSRHR issues. So I would feel better because the people who are really being affected by these issues are people who are still, the young girls between the age of 14 to 19. This age bracket of people are still in schools. They are still, some of them are in primary schools. Some of them are in colleges. So I would feel better if the government supported these private organizations which visits the schools to educate the young girls. Allow them to educate the young girls more so that they can know. We cannot talk about prevention when the reality is young girls are actually sexually active. So when you tell them about prevention and we shun away from telling them, instead of prevention, when you're sexually active, this is what you can do. So you should support those organizations that are actually trying to improve the bright future of our young girls. And thank you for your time. I'm Lauren Hill.
Another round of applause for Lauren Hill. Thank you, and I'm happy that you're at a better place and you came to the other side, you know. It's where it's sunnier, and we hope, other girls from less privileged backgrounds never have to go through what you went through. And big shout out to Tika for supporting her. And there's a song that Lauren Hill did. It's called "Do Whoop That Thing." Laurie remember that song, and that song used to say, "Can you do that?" You remember the chorus? Well, I'll attempt. Laurie, this is how you sing. And Lauren Hill was like, "Girls, you know you better watch out. Some guys are only about that thing." About that thing. So you are lying to me, eh? I got you. Lauren Hill was reminding us about some guys are only about that thing, eh? Don't be like that. Don't be about that thing. Be about change and empowerment. How are we doing? Are you good? Do not worry. We got you. So, Limpo Chinika. So Limpo, is that you? Yeah, you look like a Limpo. I'm just kidding. So Limpo is the Zambia country director and lead for HIVO's AYSRHR fund. So she'll tell us what she's been up to.
Thank you so much. Okay, good afternoon, everybody. I shall ride on all the protocols observed. And good afternoon to everybody. Good afternoon to all the adolescents right here and also the older adolescents. I still consider myself an older adolescent. So I think with regards to what has been spoken to today, I think I had a long speech, but I think a lot of discussions have been had in the panel discussion and also the discussions that have already happened as well from the audience perspective as well. So I won't really dive into my speech so much, but I think just to speak to a little of what the Regional AYSRHR Fund is about. So in essence, the Regional AYSRHR Fund is a grant mechanism, and I'm very happy that Dennis from INASO was mentioning and also speaking to the aspect of there are nascent organizations and youth-led and youth-focused organizations, but they are not given the opportunity to get funding from other organizations. Why? Because they don't have that capacity, they don't have the governance systems in place. And so as a regional SRHR fund that works across East and Southern Africa, that is the essence of why the fund was birthed and why we actually exist, to ensure that we're providing opportunities to youth-led and youth-focused organizations, to ensure that we are building the capacities in the governance systems, as well as also working around issues to do with policy advocacy and campaigns, and also knowledge management. So how are we going about this work, and why is it important for us? Because one of the aspects that I think has been mentioned from the panel discussion is the ability of the lack of information for adolescents, the lack of opportunities for adolescents, and also just the aspect of having adolescents actually speaking at certain events. And hence, as HIVOs, as the Regional SRHR Fund, we're very happy to be co-conveners at this very important conference. And I had a discussion with Nelly the other day, and I said, Nelly, we need to start thinking about actually going beyond Kenya and actually calling it RHNK something Africa. And I'm very happy that also Dennis also mentioned it. So I think those are certain discussions that already we need to already begin to have and look into the future of looking at how we can work collectively as one voice, as one people, as one adolescents as well, from different sectors of where we're coming from. And I think one of the aspects as well as the Regional SRHR Fund of what we try to do in our work is, aside from building the capacity strengthening of our partners, them being nascent organizations, we are also providing them with grants. And how do we go about this? Obviously, there's the aspect of them being nascent. They don't have the ability to have audits in place. They don't have any systems in place. And that is where we come in as a fund. And so, of course, there are certain aspects of due diligence that we carry out. And obviously, we work hand in hand with the partner. We do hand-holding mentorship to ensure that the partners, even as they come on board, are then able to have a well and qualified audit, and also the linkages and the relevant connections for them to be able to carry out that work. And so one of the aspects as well as a fund that we've realized is the aspect of youth-led organizations not being able to have the linkages to the Ministry of Health and other line ministries. And that is where, as a fund, we're working very hard with our partners to ensure that, yes, they may be working at grassroots level, but we are also making sure that we're connecting them to the technical working groups in their countries, and also then being able to do the work collectively from a national perspective, as well as building into the regional policies that are existing. A lot of spoken to aspects of the Maputo Protocol. We also have other different policies in the region and also in our countries, and that's obviously one of the things that we're also tapping into as an organization. Another aspect, we have 3 tiers under with the Regional SRHR Fund. So I've already spoken to the aspect of capacity strengthening. We also have knowledge management. And why knowledge management? A lot of discussions have come about around how data is very important. And one of the things that we do under the knowledge management portfolio is that we have youth research academies that have been birthed and that we fund the partners with. And so they're carrying out work around SRHR and adolescents and the work that they do in their countries. And obviously, without that aspect being done, we're also trying to make sure that we're linking our partners, the relevant partners, from the countries where we have operations, being Zambia, Zimbabwe, Malawi, Kenya, and Uganda, and also still being able to link them to other partners so that we're creating a wealth of knowledge, one, and also creating the aspect of synergies and also the ability to create linking and learning opportunities and also cross-learning for the partners, because we feel that is a very important aspect that we can't move without. And the 3rd tier, obviously, is around policy advocacy and campaigns. And we can't go about our work without actively engaging in different campaigns, looking at the policies that are existing around adolescent SRHR, and also looking around how we can work hand in hand together. And I think as a fund, that is one of the reasons why we were able to create synergies with other organizations, we're able to create collaborations, because as it was spoken to before, is we can't do work in silo and we need to rely on one another. And obviously the essence of still being able to work hand in hand with the Ministry of Health in the various countries where we have operations. And that is something that we're very thankful of, and also we will obviously want to continue to ensure that we have those strong connections and the linkages with the Ministry of Health. I think with that being said, that's about the Regional AYSRHR Fund, and obviously the essence of our work is to ensure that we're creating and ensuring that there's young people that are able to have a voice, and a voice on issues that have a voice around issues that affect them. Obviously, us being here today, we're looking at issues of adolescent SRHR, and that's exactly what we're trying to do. So in that, we're trying to make sure that we are connecting the young people to one another so that they can learn from each other, being able to also work hand in hand with other line ministries and other stakeholders, like I had already mentioned before. So the essence of our work mainly is to ensure that we are working very hand in hand together with other organizations, and also linking our partners to those organizations, because we want to ensure that we're creating that aspect of visibility. So I think this is something that is very dear to our hearts, and I was actually able to speak off cuff without my speech. And please do, if you would want to know more information about the Regional AYSRHR Fund and HEVOS, we do have a booth just at the entrance there. So please do come to our booth, and we can inform you about the programming that we do and the partners that we also have on board. And we also do have our youth advisory panel members as well that are also present here. So they're also the voice for the young people across the ESSA region. Aside from that, we also have a side event on Thursday at about 15:45. You can check it out on the program. Obviously, talking around issues to deal with age of consent, that's a very big topic, and also we just want to ensure that we're creating that the information necessary, and also just a platform for sharing information around the age of consent and how it's going in our various countries, so that we can also be able to learn from one another. So I think in a nutshell, that's what the Regional AYSRHR Fund is about, and thank you so much, and looking forward to seeing you at our side event and also at our booth. Thank you.
A better appreciation for Limpo Chunika. And if you're outside and you can hear me speaking, please come back in. We still have some interesting things to say. So if you're outside, please come back in. And if you still want to stay outside, please turn it down a notch lower. Keep the volume down, but please come back in. Next up, speaker from Center for Reproductive Rights, who are also co-conveners of this great 7th conference. 7th in other quarters is the number of, it signifies fullness and completion. So without CRR, then perhaps some fullness or completion may not have been achieved. So please welcome the Vice President for the Center for Reproductive Rights, Salima Namusobia.
Thank you, Baba Mali. I came in early into the room, and I sat up front, so I had not realized how many people had showed up for the conference until when I came up to take the picture. That is when I realized that actually a great number of people had showed up. And I really want to thank everybody for showing up for adolescents and youth. And Nelly and team, I really want to thank you for making the conference contagious, because there are many faces that I saw last year that are still here, and many people have confessed to being here for almost all the conferences. So thank you very much. As the Center for Reproductive Rights, we are always happy to associate and co-convene with you the conference, because, as Lorraine's story exemplified for us, as Africans, we cannot overemphasize the importance of having this conversation around adolescent and youth sexual and reproductive health rights, because we find ourselves in contexts that hardly give a second chance when there is a disruption to people's normal progress as a people who are supposed to contribute to their countries. For example, when a girl is interrupted in terms of school, it's very difficult that they will have another chance to get back to school. As you heard from Lorraine, if she hadn't got in touch with Tika, it would be very difficult for her to get back to school because, you know, many times the parents will abandon. Whoever is in charge of the education of the particular girl will abandon her. So it is important that we have interventions ahead of time that will be helpful in terms of ensuring continuity for the girls. Now, the theme for this year really resonates. It's at the core of what we do at the Center for Reproductive Rights. And at the center, we believe that every young person deserves the right to make informed choices about their health and future, free from discrimination and any barriers. In line with this year's theme, I just want to emphasize 3 things that we do believe are urgent and should be prioritized as we continue the deliberations for this conference over the next 4 days, but also to ensure that we actually go through with them once we leave the conference and make sure that they are a reality. And many of them have been already mentioned by previous speakers. So one is the age of consent and access to contraceptives for adolescents and young women. We see that in many of our African countries, there is a restriction in access to essential AYSRHR services, leaving adolescents vulnerable and without the support that they require to make safe and healthy choices. We must therefore work together to advocate for policies that eliminate barriers to contraceptive access, ensuring that young people can exercise their reproductive rights safely and with dignity. Secondly, we need to prioritize ensuring continuity of education for pregnant girls and young mothers. We must ensure that there is non-expulsion and effective implementation of school re-entry policies for pregnant girls and young mothers as a critical component of ensuring full development for our adolescents and youth. We must remember that education is a fundamental right and a powerful tool for empowerment and achieving gender equality. This aligns with the African Union theme for the year, which is around education, and is essential for breaking the cycle of poverty and improving health outcomes for generations to come. We call on governments and stakeholders to prioritize and operationalize these policies, providing the necessary resources and support systems to make re-entry a reality for all affected girls. Lastly, I want to emphasize the need to prioritize decriminalization of consensual non-exploitative sex among adolescents. We've all heard that adolescents are actually sexually active, and this is not going to stop today. It did not start today. It is not going to stop tomorrow. So we need to prioritize decriminalization of consensual non-exploitative sex among adolescents. The existence of the crime creates stigma and barriers for access to sexual and reproductive health services, and negatively impacts on the right to education of adolescents who sometimes end up in jail, yet they are supposed to be in school. We must also acknowledge the troubling regression in sexual and reproductive health rights across the continent. The rollback of reproductive rights threatens the health and well-being of millions of young people, and it is imperative that we stand united against these regressions and reinforce our commitment to advancing sexual and reproductive health rights. Collaborative efforts among governments, civil society, international organizations, and communities are essential to safeguarding and advancing the rights we have fought so hard to achieve so far. We are not where we want to be, but we must ensure that we also hold the line and guard the successes that we've achieved at the moment. In conclusion, we need to use this conference as a platform to forge stronger alliances and develop actionable strategies to advance adolescent and youth sexual and reproductive health rights in Africa. Together, we can create an environment where every young person can thrive and realize their full potential. And as always, the Center for Reproductive Rights, we are available for partnership, we are available for collaboration in advancing adolescent and youth sexual and reproductive health rights. Thank you very much.
Thank you, Salima Namusobia, VP, CRR. VP for Africa. FYI, eh? I love that. Thank you. How are we doing? Where are you? Where's your neighbor? I thought you were checking. You left your neighbor live, eh? Why? What happened? You're tired? Oh. Tomorrow we shall try to make them less tired, eh? Good. So we're almost there. Don't protest. Oh, yeah. Oh. Mombasa to Nairobi, it's a long... Or on X. Digital advocacy, yeah? Peter Ngura is familiar with that line of... Good. So, wow. Keynote speech. And you know who's doing it? My former colleague. She left me and then left me hanging. But she is the executive director of Planned Parenthood Global. And do you still write? Good. And she loves braids. So, ladies and gentlemen, please appreciate Laurie Adelman, the executive director at Planned Parenthood Global and a writer. I can pull that on you, right?
She loves it. This one?
Yeah, use this.
Okay. Thank you. Good evening. That's quite an introduction. You're quite an MC. That's really special. No one has tried to make me sing before, and now that I have a microphone, it's very dangerous that you've talked about Lauryn Hill and asked to sing, but I'm going to give this speech not in song, and I know that it's been a long day. I think that we really set a tone for the rest of the conference, and I think it's okay if some of the young people aren't here, because I'm actually here to listen to them a lot this week, so we'll hear from them more this week, I think, right? But firstly, I want to extend my gratitude. The distinguished representatives, you did really an amazing job today of listening and hearing and responding, and I think having the government officials together with the development partners, together with the international non-governmental organizations, and of course the sponsors, their support has made this conference possible. I see all the different pieces here together in this room that we need to move to the next level in this work, and that is very exciting to me, and it's giving me hope today. As the Executive Director of Planned Parenthood Global, I'm very humbled to be here. I'm very honored to address this gathering of brave advocates, because it does take bravery to do this work. Okay, this is not your average work. This is brave work. Everyone in this room today is feeling very brave. Can I see a hand if you're feeling very brave today? Yeah, this is a lot of brave people. And what happens when brave people can come together and we can be brave together and we can grow our bravery together? And that's what I see here today. I want to especially acknowledge Dr. Sheikh Mohammed. Thank you for being here, as well as Professor Jakim Osor. And I want to give my special appreciation. You've been shouted out from this stage many times, but Nelly, you are a true leader in this work. You're a visionary. You have shown exemplary leadership, and we thank you. I can't wait to see what you will do. So I'm also proud to be here not only as the executive director, but also as a new mom. Okay, and going through that journey, we've heard from Mama Molly, okay? It's a journey that makes you even more sure, even if you're already a reproductive health advocate, you know if you go through that journey. Every person should have the right to control their reproduction, build their families with dignity. That's also a part of the SRHR promise. It's about all of these things together. And I'm very proud that for over 50 years, Planned Parenthood Global has supported the locally led efforts of individual champions and partner organizations around the world to expand this kind of access, to expand access to SRHR, including safe abortion services, within the legal frameworks across Africa and Latin America. And to date, we've provided technical and strategic guidance to over 1,000 champions, partner organizations, and SRH movements across 70 countries. Last year alone, PP Global Partners provided over 500,000 sexual and reproductive health services, 40% of which were provided to young people. So that's something to be proud of, and I want to especially thank and shout out the PP Global Arrow team. Where are you? Give a little wave, give a little hand, yes. They're around and they'll be speaking throughout the conference. Yeah, please, once a PP Global Arrow, always PP Global Arrow. And please listen to them, as I often always do. They have a lot to share this week. We even helped to support the founding of the very Rhnk today that you see so thriving. And so this is a legacy of pride that we're committed to extending and continuing to this very day. Okay, the theme of this year's conference, Priorities for Advancing Adolescent and Youth SRHR in Africa, resonates deeply as we recognize Africa is the youngest and fastest growing continent in the world. So this is timely. And where are we today in terms of these issues? We've made a lot of progress, but we have a lot left to do. I've heard ICPD mentioned many times. 30 years. It's been 30 years since ICPD and also 30 years since the founding of the reproductive justice movement. I was just last week in DC celebrating with 12 founding mothers. These are Black American women who were inspired by ICD to start a new framework, inspired by the global solidarities that they saw there and the feminist organizing that they saw there. And as the world faces multiple humanitarian crises and conflicts, threatening the health and well-being of people, as well as escalating attacks on human rights, we need to call that into this room as well. So it's essential that we're standing shoulder to shoulder, and that's what PPG is here to do. Again, I want to reaffirm our commitment to this work and to this movement. And I think as SRHR, we need to acknowledge where our issues are also bigger than SRHR. So it's important to hear the issue of poverty brought into this space, issue of economic growth, because SRHR is these issues, and I think there's sort of 4 areas that I want to make sure we understand are also pathways to SRHR. Okay, so SRHR is this. SRHR is public health. Okay, we don't see this enough. Access to SRHR services is fundamental to overall public health. It can't stand alone. And at the same time, SRHR is gender. I can't tell you, I have a pet peeve when I see my gender brothers and sisters and they're not also talking about SRHR. How are you going to talk about gender and not SRHR? They're one and the same. And who suffers the consequences of poor SRHR? As we've heard, it's intrinsically linked to gender equality and it's disproportionately impacting gender minorities. SRHR and the legal sector, a lot can be said of the fear that grips providers who are given the potential or actual criminalization that I know some in this very room and some among us have encountered, and there's absolutely no reason a provider should be worried about seeing jail time or worried about the legalization of their services in determining what is best for their patient, okay? That should never be the case. And lastly, SRHR is a political and governance issue. So when we talk about democracy, when we talk about development, we're also talking about SRHR. So when we think about all of these things, we need to prioritize, and I know everybody in this room is with me, but it still needs to be said, comprehensive, universal, inclusive healthcare for adolescents, for young people, grounded in human rights, grounded in the data and evidence of what works. And this is so important, and more importantly, it's possible, okay? We have been doing this work and sometimes we get tired, we get burnt out, okay? We're feeling sometimes a little bit hopeless. It's one step forward, two steps back. So as a sector and as a movement, as a community, we need to hold on to that hope as well, that we have better days ahead. And we'll see that through collective action. So some of the actions that we hope to see, and this is what I'll end on, is to really rethink and look closely at how we operate and contribute to the growth of this movement, the growth of this network that we're building together. So the convening spaces are so important, and we need more of them, and we need to bring more people into them. So find the connections to the other movement, find the connections to climate, find the connections to economic policies. We can't only be talking to ourselves. We need equality in the partnerships that we do have. So the power shifting, the listening, engaging in equitable partnerships. How about more unrestricted partnerships, more unrestricted granting, less restrictions on the funding? Let's help each other to win. We need to shift power also to the young people, and I was very grateful to hear the stories of the young people today on this stage, and I think we need to hear even more from young people. And I have to say, as someone who attends a lot of different kinds of meetings and conferences, it's 99% of the time, it's the young person who says the most truthful thing in the room, the most relevant, what we really need to hear. We also need to undo the systems and structures which have gotten us to the inequalities that we're seeing today. So the inequities that continue to grow, that's also an SRHR issue. And lastly, we need more and better data, which we've heard a lot about today, so I won't rehash. I'm eager to see how we can leverage the platform of this meeting and of this conference all week to really explore all of these needs and priorities of young people and adolescents, okay? It's about that thing. We know that. We've talked about that, so let's also not be afraid to name that. And lastly, in conclusion, I just want to share that also PP Global is here standing shoulder to shoulder with you. We've been here for 50 years. We'll continue to be here. I hope you will find some of the PPG Arrow colleagues who are here. They're brilliant leaders in youth health and rights. They also have great experience in monitoring and research to advise on our strategies, and they are here to partner together to protect and advance the fundamental right of young people to co-decide on issues that concern them directly. Thank you so much for the opportunity to speak with you all today, and I look forward to connecting further at this conference. Thank you.
Round of applause for Laurie. Just before you exit the stage, just before. There you go. Laurie, I have to catch you on this one.
Okay.
So you're a recent mother.
Yes, it's true.
So what kind of world should we build for your child? What can we do to make the world better for your child?
Okay, I like that one. Well, you know, my son, first of all, he's only 4 months, so we have a little bit of time. But I think the intersection of climate change and SRHR is something that's been on my mind a lot as I raise a child, because this earth needs to be also here for him when he comes. And also we've heard examples of how climate change is driving inequities in SRHR, so that's something I'm hopeful for him as we can reverse some of these trends we're seeing.
And hopefully he'll love hip-hop like you do?
Yeah, exactly.
Did you forget this? No, someone else did. So if, it's branded, so could you pass it to her? And someone has lost a hood and a mug, so if you see any of those items, please alert us. And then we're at the final speaker, who looks tired as well. So I'd like to invite Evelyn Opondo, who's the Regional Director for the National Center for Research on Women, and she'll give us the closing remarks before we do one last surprise for everyone who stayed to the end.
Thank you very much. I see the room is almost empty. but bear with us for just a few minutes. I want to start by thanking everybody who is present till this moment. I want to especially acknowledge the government. I see Dr. Serem, Dr. Sheikh, Dr. Jean still seated here to the last minute. That is very uncharacteristic of government officials. So we do not take it. We do not, we acknowledge and we appreciate. And I want to thank all the other presenters who have traveled from far and wide to join us, Kenyans, non-Kenyans. We thank you for making it. I want to thank the youth who have made it this far. And the adolescents, this is your conference. Make sure that you speak and your voice is heard. Nelly, thank you. Thank you for putting this together. I want to also challenge Rhnk as we think of the next conference. I think what we saw with the conversation that we saw with the Ministry of Health here, that is what we are missing. We rarely get an opportunity where healthcare providers, advocates, adolescents, all of us are speaking with the ministry. It would really be great if we can get the Ministry of Health, or whatever, government from Uganda, government from Tanzania. Let's keep trying to get them so that we can have that dialogue. This is a critical space, and I think it's something we should think about. Now, why this conference? Previous speakers alluded to this. So childhood has been recognized as a critical period. But adolescence is recognized as the second critical period where we have a window of opportunity for effective interventions that can change the trajectories of adolescents, particularly have interventions that target marginalized adolescents or marginalized youth. Now, evidence has shown that gender gaps significantly affect the trajectory of adolescents. But these gender gaps are actually exacerbated by some of the issues that have been identified, such as poverty, ethnic background, such as rural location, and there are many things that make some adolescents just more vulnerable than other adolescents. We've heard from the beginning of this opening ceremony, adolescents are not a homogeneous group. And I think this is a point to drive home, especially for government, as we make policies, strategies, projects. We cannot lump adolescents as though they are all the same. We know that there are adolescents who are girl mothers, there are adolescents who are young and married, displaced adolescents, orphans and vulnerable, child-headed households, HIV, adolescent soldiers, adolescents who engage in transactional sex. And we have heard that. We don't like, in our minds, that is not the ideal adolescent, but the reality is that there are adolescents who are engaging in sex, adolescents who are engaging in same-sex intercourse. When you are a government and you are planning for your entire citizenry, how do you plan for all of this adolescent? Not the adolescent that is in our mind, that adolescent who is abstaining from sex, that adolescent who is staying in school. That is not the reality of adolescents and young people. And they will continuously tell us that throughout this conference. Sometimes these adolescents actually have two or more of these factors that make them more vulnerable. They can be HIV positive, engaging in transactional sex, caught in gender-based violence. So, when I come back to Kenya and we look at the laws and policies that we have, the Children's Act of 2022
requires parental consent for access to services. The National Reproductive Health Policy requires parental consent. Reflect on that for a minute. These adolescents that we have mentioned, will they get parental consent? If they are not getting parental even asking them to get parental consent is a disservice to them. It is failing to recognize their lived reality. Now, I want to take this moment to really appreciate the healthcare providers in the room. These are the people that provide services, including abortion services, including access to contraceptive to this adolescent, in spite of the stigma, in spite of the police harassment, in spite of the prosecutions. And there are a number of providers here who are either facing criminal prosecutions or who have been harassed. That is where the rubber meets the road. We can talk all we want, but if adolescents cannot get services, we are doing a disservice. And so I really want to acknowledge all the healthcare providers who provide these services in spite of the hostile environment. And on that note, I also acknowledge Mary Stopes Kenya for the gap that you fill. In spite of all the attacks, you keep standing. Thank you for filling that gap. Now, it's only through sustained collaboration that we will achieve the resilience that we need so that we can push the pushback. Salima mentioned, how, there are organized groups, transnational. And so we must work together in order for us to overcome the challenges. And the challenges are many, but we can overcome them. And so my call to action is four-pronged. One, meaningful youth participation. We have underestimated the power of Gen Z and the young people. But today, if you watched the streets, the young people were on the streets. We thought they were disinterested in some of these things. The youth, you can make changes. You can push. And so I want to encourage us to involve them meaningfully. Two, we must reach the vulnerable adolescents and youth. We must come with the mindset that they are different and we must do harm reduction and meet them at their point of need. Three, tackle the social norms and ideologies that hinder access to adolescent access to services and information. And the last one, let us use data and research. We are living in a post-truth era. There's a lot of misinformation and disinformation, and particularly that is used by the other side that does not like sexual reproductive health rights. And so we are calling upon us. This is a scientific conference, and it is an opportunity for us to learn from the evidence, the best practices, and what we can borrow from each other. And with that, may this conference be a catalyst for positive change, echoing far beyond these walls. And finally, I want to take this opportunity because I know there'll be some speakers who will be leaving before the end of the conference. I want to really appreciate you for coming and joining Rhnk for this conference. Lori, I appreciate you. I appreciate everybody else who is leading. And that is on my heart as the Rhnk Vice Chair. And with that, I thank you and we welcome you and celebrate you for joining us for this conference. Asante sana.
And we also thank you, Evelyn Opondo, always a strong supporter of Rhnk and other interesting matters. Follow on LinkedIn, like I do. Mama Mali, what's next? Oh no, that was unintentional.
That was unintentional. Joanne is like sabotage. I'll use this for now. I think everything has been said powerfully by our esteemed speakers. Thank you so much. This is something that's core passion. I learned from Eric today. It's also been a journey of his. And it's always important to come together and recognize that we have shared passions, but it's about moving to action. And by the way, you should ask yourself, what am I doing to integrate young people in my space, on my platform? I actually have a podcast series called My First Time Stories, which I handed over to young people. Because really, at the end of the day, they have a lived reality that only they understand. So do what you can with what you have, where you are, to bring in young people to the conversations that you're having. I'm going to stop there. Don't ever give a news anchor a microphone. We'll talk till tomorrow. I think we have one more thing to do.
One more thing,
before we release everyone
Just as
today.
an appreciation for you staying until this particular time. So, my good people, I wait for your cue. How do we go about it?
I think we need to line up some folks on the stage? Pam is doing sign language at the back of the room.
Yeah.
Pam is with Rhnk, guiding us. There is just one more moment that we want to do before we release everyone today. Yeah. Look at her. She's saying, please come down.
I come down?
They come up.
Good. So everyone or
all the
speakers?
Can we please be joined by our
so
speakers?
If you are a speaker, if you spoke
please
today,
Jean, Joanne,
please
come.
Please come. Come to the stage.
The government as well.
The government is not a monster, as Serem said. So please join us. Some magic.
Wait.
Wait.
So once we have everyone, wait.
Wait.
I think it's pyrotechnics.
Could we have is that the tempo we're gonna go with? It's your anthem. I'm sorry. I'm a bit too like high tempo. Okay. Yeah. So, one last act.
Okay. Do we count down from 5 to 1?
Good.
Okay, Baba Mali. 5,
4, 3, 2, 1. 7th Rhnk conference. Whoa. Yes. Oh, there you go. Let's light it up. Yeah. Love it.
And that's the photo moment. That is the picture. That one. I think that's good. Pam, if we're good, Pam, we're good.
If Pam is good,
if Pam is good, we're good. All right. I think we can invite everyone to take their seats back, interact, network. Any other words, Baba Mali?
Tomorrow, 7:30 a.m. Be early or else. But also remember to download your abstract from the website so that you follow and choose your sessions. But we'll guide you in the morning. Okay?
Yeah. Thank you, everyone, for being here for day 0.
Day
1
wow.
starts off tomorrow. As
Yeah.
Baba Mali said, nice and early at 7:30. God bless. Have a good evening, network, and enjoy yourselves.
Enjoy. See you tomorrow.
See you tomorrow.